Evening, everybody. Welcome to the Housing and Environment Open Scrutiny meeting. This, the Thursday, 27th of June, 2013. We are in the council chamber tonight rather than committee room 1. I don't think it makes any difference to the meeting. We'll just carry on as normal. On the agenda tonight, there is no fire alarm scheduled, so any fire alarm is genuine. Please don't get burnt. Please get out. Normal procedures, everybody knows, they're in the stairs and in the War Memorial. Webcasting of meeting, we are webcast, again as per normal. Apologies for absence. I think we're quite unique, we have 0. So we have an apology that he may be late from Stephen Peach. We have no apologies for absence. And no resignations and replacements. Again, that's quite unique. Declarations of conflict of interest or whipping decisions. If I may interject here, item 10, we may have an issue coming in regarding landlords' issues. So there will be many members that, and I'll declare an interest on their behalf here on item 5 for when item 10 comes up regarding any landlord-tenant issues. Councillor Mrs Baker.
Thank you, Chair. Sorry, you have confused me because the agenda clearly says there are no referrals under item 10. So surely we cannot be having an item under item 10.
I'll ask the officer to clarify.
Sorry, we do have a referral from the P&I committee which was actually made after the agenda was produced, so we were going to introduce it this evening when we got to item 10. That issue is before you on the desk there.
But I'm sorry, I thought if it wasn't clearly stated on the agenda, then we shouldn't be considering it.
Councillor Mrs Baker,
unless it's an urgent item.
Would you please let me deal with it through the chair when we get to number 10? I've only mentioned it now at 5, so we don't all have to put hands up for an interest. Councillor Mrs Still.
Thank you, Mr Chairman. Paper E, because of a family member, a connection, maybe, I may have a personal interest, so, but I have been advised that I can participate in Paper E and take part in the discussions.
It is noted, although I fail to understand how you can have oh, right, okay, fine. It's noted in the minutes. Okay. Item 6, there are none. Item 7, we have 2 sets of minutes to go through, please, due to we having an extra meeting. The minutes of the 8th of May and the minutes of the 23rd. I'll take the 8th of May first. Do we have a proposer and a seconder? Councillor Mrs Washbourne.
It mentions at the bottom of the page 6 of 113 that Karen Randall was going to circulate the packages of services available and a number of other items are mentioned.
If I may interrupt, I have asked the officer to put a copy of all of these in each group room. Could you just confirm that's been done, please?
Yes, please. Thank you.
Thank you for bringing that up. Councillor Mrs James.
Can I ask, when they went to the group rooms, when were they put in the group rooms?
I'll ask the officer to clarify.
They were actually put in the group rooms earlier this week, but the original email was sent on the 30th of May to all members of the committee, responding to all of the issues listed at the bottom of page 6. Can I just clarify, because I've just been handed the pack. So when you say earlier this week, today's Thursday, it went on Wednesday morning. So it wasn't early, it went midweek, Wednesday morning. Yeah. And in relation to all of the other information in that pack, that was emailed out to us when? Okay. And in relation to, and in relation to just point 6, that the Kate will email members a written justification of the proposed empty homes target. Is that the target now is in the report is the 10?
I believe it is, but I'm just going to clarify. I don't want to tell you anything wrong.
Sorry.
Yeah, the target was suggested at 10, and there is a written justification for using that target, item 4 on the pack that was emailed out.
Can we propose and seconder, please, for these minutes? Thank you. And a seconder?
Comment if you can, Chair. Being reminded there was a question raised at the last committee meeting regarding Project Integral report for some information to be circulated on the advertising budget. Unfortunately, we haven't circulated that information, but just to say we will do that as soon as possible.
Just to clarify, that's on the 23rd of May minutes. Can we just put the 8th of May to bed, please? We have a proposer, Councillor Reid, seconder. Do we have a seconder for the 8th of May? That causes a... Oh, am I allowed to second? Oh, thank you. Councillor Mrs Aldridge. Thank you. So the 8th of... All those in favour? Thank you. That's 8th of May sorted. 23rd of May, we have already heard from Veolia that there is some information coming. Do we have a proposer and seconder for the 23rd of May, please? Councillor Mrs James.
In relation to 7.1 of the minutes, it talks about that a report will be provided by officers in relation to the open space. I haven't seen the report. I wonder when we'll be receiving that report and to what committee that will be going. And my other point in relation...
Carry on, Mrs James.
And the other point I wanted to raise is that I raised at this meeting in some detail about the minimum and expected standard of open space in relation to the target, and we had lots of concerns in relation to that, but there's no reference to that target and the minimum and expected standard, because we had a view that should we have a minimum, and it should be really an expected. And I think historically and at this meeting again, everybody had the view that it should be expected.
So far as I'm aware, the minutes are correct. If you're suggesting they're not correct, it would have been helpful to bring it up before the meeting. We could have gone through the webcast. We do not, at this stage in the meeting, we don't have time to go through the webcast for checking things. All I can say is if that's your recollection, it is some time ago. I can't actually remember without the webcast checking. So as a general comment, if you wish to bring stuff up about the minutes, please do give the officers specifically, because I will ask them to check the webcast if there are some issues. Are there any other queries on?
So if it's of any help, I certainly do recall the issue of the a report being prepared with contributions from ward members. That I certainly do feel was part of the debate, and I would concur with that. So I suppose the question still stands.
I will ask the portfolio holder to comment on this.
Thank you, Chairman. I've just received the first draft of the officer's report based upon the two Ofcom meetings. I have to say I've received the email. I haven't opened the attachment yet because it came in earlier today. I'm expecting it to be in there. That was our expectation. So we'll come back to you with the suggested way forward.
If it does help matters, I can remember that report going, because I remember I was keen on it, and I believe it was the whole committee agreed. What we haven't set is a date. It is in progress and is happening.
Chair, and in relation to the target, and I remember Councillor Reid sharing the concern, it was about the expected target, and there was a minimum target, and we had concerns that developers would opt for a minimum. So why would we put in a minimum when there was an expected?
I can recall some discussion. I'll ask Councillor Reid to carry on.
Sorry, Councillor James, were you talking about the woodland buffers on that? Because I remember the debate on the woodland buffers and that we were concerned at the minimum target on that.
No, it was in general, in the targets, in the, I can't remember what page it was, but there was in relation to open space, there was a minimum expected open space, and then there was an expected. And the concern that we had as a committee was around the, we were allowing developers to opt for a minimum, and in relation to 106, developers would always go for the minimum. And so what the argument was why have a minimum? There should be an expected target that we expect as a council, and why would we give them a minimum?
I'll ask the portfolio holder to come in here.
Thank you, Chairman. The process we have in this council is that it comes to an Ofcom, and then we ask officers to go away and look at that, and then report through to the next stage, through to a cabinet report. The officers have been doing that work. I said earlier that we're looking at that. I think we need to respect the officers and say they need some time to do that. It will come up at cabinet. I've already given my commitment that I certainly both attended those ones to go through. Now, we can have the argument here, but it's going to be in the cabinet report, and I would have thought that is the stage, Chairman, in order to continue this discussion.
Mrs. James, I would point out that we are making sure these minutes are factually correct. We're not actually
That's the
adding.
issue. This is about whether these minutes are factually correct. And I think the cabinet member, I have concerns as to what he's saying to us tonight, because I sat last night on planning and infrastructure where we're looking at the new local plan, and the target that is in the new local plan hasn't altered at all. But we need to demonstrate as a committee that we weren't happy with that, and we also need to demonstrate that planning and infrastructure weren't happy with that. And I got the minutes altered last night because the minutes weren't correct, and I intend to get the minutes altered tonight because we need to demonstrate that members are not happy with that target, and we are developing a local plan with an expected and a minimum target, and that is allowing developers with an opt-out, and we will end up with less open space. And I'm already seeing it within my own ward. And so I want minutes to be factual, and it is essential. And this isn't about cabinet at a later date, because like I say to you, last night, that report is before us in P&I, and it hasn't altered.
I hope I can resolve this issue. The officer said she'll check the webcast, and could I ask you just to clarify how we actually change the minutes if we pass them tonight?
Thank you. I'd certainly remember the debate. What I would say is if it had been recorded as the will of the committee, it would be reflected in the minutes, which is why we need the opportunity to go back through the webcast and see what the context of the debate was and whether there was a view of the committee to amend that part of the report. So I'm afraid you'll have to leave it with me.
Councillor Mrs. Aldridge.
Hi, I just want to concur completely with Laura on this. We've had two full meetings at this committee now debating this expected space standards. It was like a bit like deja vu last time round. The same things happened. It's not in the minutes, and I think we need to actually write in the minutes that this is going to be followed up, and I'd like that to be recorded in the minutes. Because it's just the second time we've had this debate now about whether it was said or wasn't said. Yeah.
I'll ask the officer to comment.
What we can do is record in the minutes that there is a concern over the previous minutes, but we'll have to check because my recollection is that there wasn't a view of the committee on that point. There were a number of comments raised and questions for the officer which they took away, as Councillor Donnell has pointed out, but I do not recall a view of the committee being recorded for that particular issue, so we do need to check.
In that case, I don't think we should sign this off until we've got that agreed. And I'd like to go away and look at those that webcast as well, and that's why I'm not prepared to sign this off.
Members, we're all
Because
hearing
it
what's
also
going on.
says provide the following. If you look at number 1 on 7.3, it says to note the report and provide the following comments, and that was definitely a comment of this committee. And it was in the following one because we raised our concerns that the cabinet member had not carried out the will of this committee in relation to those targets, and we had real concerns regarding Councillor Donnell's commitment to us as a committee.
Members, you've all been in this room, you've heard the discussion. We can sign these off if the majority agree they're correct, with a note in these minutes from today that this discussion has taken place. Yes, I'm getting a nod. So do we have a proposer and seconder that the minutes are factually correct, even though there'll be a note in today's minutes that this discussion has taken place?
Chair, I'm just wishing to clarify whether it's just a note to say the discussion has taken place, which is one thing, or that the webcast will be reviewed, which is what was said earlier, to establish what was actually agreed, because that I could live with, but I couldn't live with just saying, oh, it's been discussed, because that doesn't resolve the issue.
It will be both of those things, a commitment to review the webcast and make an amendment, if appropriate, in these minutes to reflect that the previous minutes didn't record that.
Thank you. I hope we're clear. So can we pass these minutes of let's get the date absolutely correct, 23rd of May. Do you have a proposer and a seconder, please?
On that
Councillor
basis,
Reid is proposer.
second.
Okay, thank you. We have a proposer and a second. All those in favour of the minutes? Thank you. Sorry, I've had favour. Are those
Sorry,
against?
how many is against?
Any against? Councillor Mrs. Still.
I wasn't here at those 2 meetings you're talking about, so do I have a vote? And am I allowed to, I can't participate in something when I wasn't here. So I know everyone's looking at me thinking, why she's not putting her hand up. I just want to make that absolutely clear. I was not at that meeting.
It is very clear you are constitutionally a member of this committee tonight. You have voting rights tonight. That is clear cut. Right. Yes, you are on tonight's meeting constitutionally. There were 3 members that voted against those minutes. Could we just clarify? Oh, I don't like re-going to votes. That's against my principles. But can we just clarify those for the minutes, please? 2, 3, 4, 5, 6. Right. Members, to me, that's quite clear. And I hope it's clear to everybody. Thank you very much. Those minutes have been passed, but there will be an article in today's minutes of this committee regarding what the officers said. Thank you. Paper B. I should go to item 8 on the agenda. Member and public participation and standing invitation. We have member and public participation on 8 and 9. They will come in at the correct place, which is after the next paper. 10, referrals from other committees of the council. Would the officer like to introduce this, what we have here?
As was mentioned earlier, we do have a referral from P&I. As Councillor Baker's pointed out, it isn't listed on the agenda and it isn't an urgent item. the first question for the committee is, do they want to accept the referral? And if so, we could get it onto an agenda for a future meeting. The referrals from P&I, it's in front of you on the desk. It's the issue that was presented as part of the evidence base relating to landlord possessions and why they are or appear to be higher in Basingstoke. That was the paper that was at P&I. The question that was actually raised is to make a referral to this committee to establish why it looks as though Basingstoke and Deane has a higher rate of landlord possessions than our counterparts. I beg your pardon, I thought I had them, so I assumed you did. Sorry.
Right. Because it's not on the agenda properly, I think it's improper to discuss it tonight. But what I would like to clarify is, are we all happy that this goes as an agenda item at the next available meeting with an officer report? Thank you. Councillor Mrs James.
I was at the P&I meeting where this was actually referred and asked to be referred back to this committee. And I think it's important that we, as a council, now start to look at that practice. And maybe we, as a committee, might want to refer things to P&I and other committees. And I think we need to all start doing that more. And this came up that we have higher than the national average of possessions in the private, in housing, and also court orders. And I think it's an important piece of work that we look at why that is the case. It's not even that we have higher than Reading and all of Hampshire, but we actually have higher than the national average. And I think that's quite concerning. And so it is a piece of work that we should be reviewing and looking at as a council.
It has actually been put to the members, and they've agreed that we have it back at the next available meeting with an officer report. The officer would like to speak.
Committee, if I may, the next available committee is quite tight on deadlines, considering the importance of this piece of work. I'm advised by colleagues that November would be more appropriate. Is that acceptable to you, please?
I believe it has to be if we wish to have a proper officer report on it. Anyway, thank you. The reason I brought this up under item 5 is because a huge number of us either have rented accommodation or live in rented accommodation. So I did an overall cover to cover us on that. Item 11, there are none. Item 12, single issue panels and working parties. Climate change panel. For your information, it's in front of you. Could you only speak if you disagree with that list, either want to come off or on? Does anybody wish to change it? In which case, I'll take the climate change panel as read.
If I may, Chair, I was just wondering, I haven't conferred with him, but I was wondering whether with his present workload he was going to be able to take that on board as well, but he hasn't said anything to me, so... But no, wasn't he? Well, he is. He's a member, though. So why didn't I hadn't noticed that?
We'll move on to tree shading, thank you. Again, we have Councillors Beerman, Hussey, Keating, Leeks, Mrs Tucker. The Labour group have put a nomination through for Councillor Mrs Frankham, that hopefully we're all happy to accept. Sorry, my apologies for misreading. Councillor Paul Frankham. Yes, it's like gender. Is everybody happy with that? Thank you very much. Portfolio holder.
Just for clarity for my tree officers, is that Councillor Keating's coming off to be replaced by Councillor Paul Frankham? Or is it... Yeah, it is. Okay. I just wanted to clarify for the officers.
Right. We'll now move on to item 13, which is paper B. And portfolio holder again.
You actually missed item 9, I think. Invitation to portfolio holder.
I tend to take 8 and 9 together here and just welcome anybody that can add to the debate. They're welcome to come. Certainly you can.
As you know, I like keeping this committee informed, especially of good news. We've just had the first data back for the amount of small electrical items recycled in our wee bins. And to date, and I think it's been about 3 to 4 months, we've recycled 5 tons of small electrical items, which is much higher than we had predicted, and frankly is higher than the other models we were looking at around the country. Put that in context, it's the weight of an Indian elephant, 5 tons worth. So, piece of good news on how we are increasing things.
Thank you. Now, what I wanted to get to paper B, which is response to cold weather. I trust people have read it, and I'll ask the officer to introduce it.
Yes, this report responds to the request made by the Chair for an officer briefing paper following the request made by Councillor Miss James on the 21st of February 2013. It provides an overview of the provision made in winter 2013 by the Council, the County Council and partner agencies, and considers the specific response to the needs of rough sleepers and the vulnerable in our community. It also outlines the Council's general emergency planning response in the situation of freezing temperatures and snow. A full scrutiny of the Council's response to severe weather conditions was carried out in 2010, therefore this report primarily focuses on the recent period of cold weather. During this period, the Borough fared better than in previous years and no emergency response was triggered. The Council's role during this time involved providing information and advice to residents, working with local organisations to provide specific support for rough sleepers and vulnerable people, and assisting Hampshire County Council to grip footways, car parks and other facilities. The general response to emergencies is guided by the Council's emergency response plan that enables it to perform its function as a Category 1 responder. The plan is tried and tested with relevant partner agencies to ensure that officers are prepared to respond when a real emergency occurs, and we'd be happy to take any questions.
Thanks, Mrs. Baker.
Yes, I found the report interesting, and it did prompt some questions in my mind. In para 415, there was a comment that the outreach team were able to make contact with one person, but were not able to contact the others. And I wondered whether there was any further information as to why they felt that this was the case and contact wasn't able to be made. I've got 2 others, so if I can just, yes, shall I give them? And I know this is referring to Hampshire County Council procedures rather than our own, but I did wonder in para 511 whether we thought that using HantsWeb was the best way of disseminating information to the target audience, and whether we felt we should make any comment about that. And then the final one was about emergency planning, and was wondering whether a severe weather scenario had ever been the scenario that was used to test our emergency planning response. Thank you.
I can pick up on the outreach question. The short answer to that is no, we wouldn't know why a particular report through StreetLink, which doesn't give a name of an identified rough sleeper, wouldn't necessarily result in a successful link up with an outreach worker. That's not an uncommon occurrence with this nature of work, given the time that a referral takes to come through StreetLink and go through to an outreach team. What has happened since we hooked onto the StreetLink scheme is that we've been working with our partners and a number of other authorities to actually improve and strengthen the work that we're doing on outreach, which has included getting some additional money in from a sub-regional fund to ensure that the outreach team can work more out of hours, so not just between sort of 9 to 5. That will be kicking in from July when new funding kicks in. So the short answer is no, we don't have an answer, but we are constantly aware of the risks of this type of work and seeking to improve the response that we're able to make to rough sleepers. somebody could be rough sleeping just for one night in our borough at any one time. It's part and parcel of the nature of the issue that we're dealing with.
Any further questions to the officer? Councillor Mrs James. I'll revert back to the officer.
Yeah, just to come back on your question, the information provided on the Hampshire County Council response on the hitting the cold spots was not exclusive. Obviously, Basingstoke and Dean Borough Council also provided a wide range of information through a variety of media channels. So that was obviously the Basingstoke and Dean Borough Council web, but also Twitter and other updates such as newspapers, etc.
Has that answered?
Well, yes, except it just makes me wonder, has anyone done any targeted surveying of those vulnerable to severe weather to find out what sources of information they would find easily accessible? Because obviously those should be the sources then that we use. And if they say the web and Twitter, well, great, that's fine. Then we're using the right tools. Just about to be certain that we're using the best way of getting information to the people we want to get information to.
It is a very valid point, actually, because I'm unsure myself what access they would have. But if you have any points, please do email directly. I'm sure it will be useful. Councillor Mrs James.
Thank you. I'm not sure in relation to the question that I asked that this report actually answers it, but the first, yeah, no, I just thought it was a appalling response. Thank you.
I'm sorry, I've had a sort of answer to the second question, but I'm still waiting for the answer to the third question I asked, which was about the severe weather scenario being used to test the emergency response.
Back to the officers.
Okay. Just to something else that I wanted to mention as well in terms of information that was circulated. There was also information circulated to our voluntary organisation partners as well, which was then disseminated to communities. So that would have sort of perhaps got to that group that you were talking about. And then to finish your question about whether the severe weather scenario has been used, I don't actually have the answer to that, but I think my colleague does.
Sorry, I'm here actually for the toilet report, but I'll... in the 8 years that I've been involved with emergency planning, I can't recall us testing a snow scenario, and I think the reason for that is that nearly every year we do have a snow scenario, so we get to test it. The severe warning or the severe weather is usually tested with flooding, and we've tested that both locally with scenarios, and we also tested it where we set up Gold Command at Netley. So that involved the whole of Hampshire, and we ran that as if that was a really significant issue with flooding and evacuation of whole town centres, and Hailing Island was drowning, and it was a very big, I think it lasted 2 days. So yeah, that's the sort of thing where we do test those.
Right, Councillor Mrs James.
Thank you. My question is in relation to 4.1.1. Sorry, no, it's 4.1.2. The housing strategy identifies that we now have 8 rough sleepers. And the trend is up from 3. Can I ask, in relation to May Place, May Place is, as part of this strategy, is going to pick up those rough sleepers when the temperatures go below 0. Have they got the capacity to do that? And the question also is, then what happens to those people that are living residents in there, and where will those people sleep in May Place? And is there additional funding available to them? And also part of, and if I could just, it's following on really, is in relation to the housing strategy, we're talking about no second night out for rough sleepers. And also in that is expecting May Place to really pick up all of that. And my concern is a capacity issue really, that we're asking a lot of. question I had really was really more about what are we going to do, and it's really, we're saying, down to you, May Place.
I'm glad you asked that question. The cold weather in January coincided with an increase in rough sleeping that we became aware of, and the arrangements at the time were the best that we were able to do, and they prevented any fatality happening on our streets, which was essentially what was designed to do. The housing strategy recognised that we would need to review the cold weather arrangements, and that was specifically cited within the strategy, and we had already set work on doing that with our partners. Since we started doing the work, we've done a number of things. We've been speaking to one of the other supported housing providers, which I don't believe they'll have a problem with me naming them now, because they've confirmed what they're able to contribute. But Home Group, or Stonham, are looking at how we can use Mary Rose Court as part of the cold weather arrangements. So because of the location of May Place in the centre of town, we will have arrangements which we will have in place by the time I'm anticipating we won't get any cold weather for at least the next couple of months. Hopefully, touch wood. Fatal error. That there would almost be a sort of like triage arrangement at May Place, whereby people can be assessed and signposted towards Mary Rose Court, whereupon funding will be made available to reconfigure the physical arrangement of accommodation at Mary Rose Court. So we'll actually have a provision whereby we can put up emergency beds in the event that we need to actually have people bed down. I think on that occasion, the one person that was referred to actually did sleep in the foyer area that time, and we recognised that that wasn't appropriate, particularly if rough sleeping was going to become more endemic, and we hope that it won't be. But we do have what I would consider to be far more robust and resilient mechanisms in place. The planning has been taking place, and we will be looking at getting funding either through external resources or through sub-regional funding, or making use of our own homeless prevention funding to actually put into effect the physical changes at Mary Rose Court, and making sure that that's a safe arrangement as well. So in terms of cold weather, the plans that will and arrangements that we'll have in place should be more robust and fit for purpose by next summer, by next winter. In terms of no second night out, remind me what the question was again in relation to no second night out.
It was just really that, again, it was May Place that was going to be picking up, and that was my concern, that it's all being funneled towards May Place.
Yeah, what we've been doing in relation to no second night out, and we needed to utilise the new floating support service that was going to come online from April this year, that we're partly contributing some funding towards. Stonham will be running that outreach service, so it'll actually be Stonham that will be the first point of call. And we've also levered in some additional sub-regional funding, which I've already mentioned, to top up that outreach service, to provide some additional capacity and expertise within that outreach service. So that will be the first port of call, and we're putting together a network of services which will aim to deliver the guarantee of no second night out or an offer of accommodation, whether that's in May Place or whether that will actually be through any reconnection protocol with any other local authorities, because not all rough sleepers will necessarily be Basingstoke and Dean's rough sleepers. So having that arrangement in place, and with other frontline direct access services within Hampshire, that may include Winchester Night Shelter. So it's a whole network of arrangements that will take us from that first notification to lever in the outreach services, and then from that to move towards getting people signposted and served into the right services. Of course, whether or not service users choose to accept the offer is another thing, but I think what I hope the committee can take some reassurance of is that the no second night out arrangements are becoming far more resilient and robust as a result of the work that we've been doing with partners.
Thank you very much for that. Councillor Mrs. James.
So I've got several questions, but so in relation to the other part of 4.12, so if people don't choose to come in from the cold, what facilities are there available to people who just want something to eat or somewhere to shelter during the day. And what I quite like in all of this, and what I was aiming for, is that at some stage, you may be able to give it to all members and all stakeholders. Really, this is the procedure, and this is what's, that's what I'd like to have. So when those members of the public that emailed us last time had concerns, we can say, this is the menu, this is what you can have, and this is available, this is what's available. And I'd really like, because Norden is one of those areas with the hotspots behind the station, is that we find some way of disseminating that information to those people that are rough sleepers in that area, because the report identifies Norden as being one of the hotspots.
Yeah, you're absolutely right. That's where we need to be to in terms of a state of readiness, so that all partners and all volunteers and all agencies are aware of the arrangements that can be made and what facilities are open and available at which particular times of the day or week. I mean, as a contributory element to that, the council has been working with the Camrose Centre, working with all the other agencies engaged in providing support for these most vulnerable members of the community. So in terms of the array of services that will be in place, I would anticipate if you give us another sort of 4 to 8 weeks, we'll have something published, because all of this has been, the work on it has been sort of happening whilst we've been developing the strategy and whilst the scrutiny work has been taking place as well. So it will come to fruition. It's not ready now, but it will be there to disseminate.
Any other? Councillor Mrs. Waldridge, and then Councillor Mrs. Still.
Thank you, Mr. Chairman. Really, I just wanted to say
Sorry,
that...
could you let Councillor Waldridge go first? My apologies. Sorry, Councillor Still.
Thank you. A couple of questions. First one, a question to Kate, if that's okay. Just how would you define cold weather? What temperature does this trigger? This whole procedure trigger?
I don't know what the temperature is. We get flags either through the corporate emergency planning or through Homeless Link. It's a flag that comes into us, and we then put all our services on alert. Exactly what that temperature is, I'm not quite sure. It's taken from the Met Office.
Yeah, Kate's right. We get cold weather alerts, and that tells us quite often you'll get in the winter cold weather expected. Be prepared, but then they notch it up a level, and that's when we would trigger things like that.
Thank you for that. I just want a follow-up question there. I mean, what I'm trying to get at is if temperatures reach, for example, 0, which can be obviously a very dangerous temperature for anyone sleeping out, would you at that point look at making provision then for anyone who is rough sleeping or homeless at that point, even though it might not be snowing or whatever? Because that's what I know happens in Surrey. The Surrey local authorities, if they're expecting temperatures to hit 0 for more than 2 or 3 nights, it then triggers the local authorities making provision for rough sleepers and people who are going to be homeless.
I think what I need to describe is the arrangements that will be in place will be a state of readiness, if you like. So whereby as soon as the decision's been made to put on alert, because the services are there, it's a case of notifying all of those who are involved in making those services alive, if you like. So, for example, Mary Rose Court that I've mentioned will have a physical arrangement whereby beds can be put up, and we'll have an arrangement with them whereby, if necessary, the additional support to make that service safe will be funded through our emergency arrangements. So it's literally a case of making the phone call, sending the email, and services will be there on alert, ready to receive. Because the issue about working with rough sleepers is that it actually takes quite a lot to engage with rough sleepers to bring them in from the cold. And sometimes it's actually an opportunity to get that engagement to start working in terms of the cold weather. So, there's a whole host of reasons why we would do it and why we would do it in that way. but also that if we're going to bring rough sleeping to an end, we need to make sure that rough sleeping can't be a permissible sort of state to remain in, if you like. So it will be a leap for service users to engage with us, which most of our local rough sleepers are known to us and have a pathway mapped out for them. It's a case of when they choose to engage with us, and they're more likely to do that when it's cold outside.
Follow-up question there. I totally see what you're saying about rough sleepers, but I'm not necessarily talking about rough sleepers. I'm talking about people who may or may not have somewhere to sleep that night. They may not be general rough sleepers. They may be just people who are sleeping, and to make provision for people who are homeless that night if the temperature has reached zero. And I know certainly in Surrey we have people like that, and they might not be entrenched rough sleepers, and the Surrey local authorities make arrangements for those people if they become homeless, and they may not be priority need, they may not have multiple a priority need group, but if the temperatures reach a certain level for a defined period, they then have arrangements made for them. And I just wondered whether you could, as part of your procedure that you're looking at now, look at that as a model of good practice, and possibly look at incorporating that in your procedure, and maybe. Thank you.
I'm quite happy to look at, once we've developed the network of services, comparing it to other authorities. Of course, the issue is whether or not the nature and prevalence of rough sleeping in one county is the same as another. And I would be inclined to say that this is not a general service provision to the numbers of sofa surfers that are necessarily out there, because it literally is dealing with people who are rough sleeping. And in our experience, lots of rough sleepers do actually find rooms, find beds for occasional nights at a time, often with other people who have been rough sleepers in the past. What this plan and what these arrangements will deal with is literally people who are rough sleeping.
Councillor Mrs Still. So I'm going to have to go round. We are rather labouring this. Carry on, Councillor Waldridge.
Thank you. Sorry, I'll be quick with this one. It is relating to the question that Councillor Baker had earlier, in particular with reference to this hitting the cold spots scheme. I distinctly remember getting something in the members' bulletin in this, and it was roughly about February time. And I at that time I wondered, well, why are we getting this now? Why didn't we get this back in October, November? And I just wondered what arrangements were in place with Hampshire County Council so that schemes like this we hear about at the start of winter, not in the middle of winter, because I remember seeing it and thinking, well, if I'd have known about that, I could have referred this resident to it back in November or December or whatever, and not in whenever we got it in the members' bulletin. So it's, I suppose, sorry, it's a comment, but the question is about the arrangements with this department at Hampshire County Council, whoever is promoting this at Hampshire County Council. Thank you.
I don't have a response to that at the moment, but would be happy to email it round afterwards.
Just stick your light on.
If the scheme happens again next year, could we be informed earlier in the season so that we can benefit our residents more fully with this service? Thank you.
Thank you. Councillor Mrs Still.
Thank you, Mr Chairman. Sorry for butting in earlier, but this is my first committee meeting for 7 years, having come off the cabinet, so here we go. Yeah, I think this is a really good report, and it's a very detailed report, and I would just like to say the residents of this borough can be assured that they will be looked after by this council in times of very cold weather. I mean, everything that's in this report, I think, looks towards what we've done, what we want to do, and I just think it's a very good report. Thank you. That's all I wanted to say.
Thank you, because that's similar to what I was thinking. But Councillor Mrs Washbourne wanted to speak.
Thank you. I know a couple of my colleagues have already mentioned their concerns in regard to the temperature, and I hope that's something that can be looked at. Obviously, as this is ongoing, as you said to us, it's a work in progress, another 6 to 8 weeks before it comes to completion. One of the things I was going to ask is, at that point, can it be brought back to this committee so that we can then see what this is going to be in its entirety? And obviously then that's going to help us brief it out to our residents
make full use of this.
Could I just clarify? You're asking for what the temperature trigger is? Is that the question?
That's right, yes, that's what both Councillor James and Councillor Woodridge have previously asked as well.
I believe the officer's already answered it, but I'll ask the officer just to clarify it again.
I did answer it, but I think it's a good point to look at, because the trigger that that would have made me trigger the response that we did last year traditionally is linked with snow. It's not traditionally linked with 0 degrees for a sustained period of time. Those aren't the sorts of warnings we get round, but we do get that information because we then trigger our street care guys to go out and do gritting. So it wouldn't be hard for us to get that information, but we would need to look at models as to when you would implement that, because clearly temperatures could hit 0 every night of the winter for a short period of time. And I think your point was that it's over 3 days or something. Yeah. So I think it's something that could usefully be looked at.
I believe the second part was, could it actually be circulated out to members, or somewhere or other get back to members?
No, my second point was that obviously, as we understand, this is a work in progress at the moment. It's not at completion at this time. I was asking whether it could be brought back to this committee when it isn't completed, so that we can then review it again in its entirety.
That's certainly something I can do and bring to the committee partners who were actually involved in delivering that out. If that's what the committee wants to see, then I can arrange that.
Thank you. Were there any other councillors who have some questions? Mrs. James, your name? Okay, thank you. Well, if I could summarise on paper B, at the bottom of 12 of 113, we have a recommendation. The committee is asked to note the contents of the report. I'm pleased from this that we seem to be leading in good practice, and the officers well and truly on top of the job. So thank you very much, and thank you for coming tonight for the report. Oh, sorry, Councillor Reid, did you want to speak? Okay, comments?
I'd just like to thank Karen for this response she gave last winter. I thought you were brilliant in the way you informed members at every juncture when the weather was poor. You're really bad, and I think you did an excellent job, and I just want to thank you for that. That's okay. That's a positive comment.
Councillor Mrs. Reid.
Thank you, Chair. I just wanted also to recall my thanks and hopefully thanks of the committee for the bin crews and for their really hard work and amazing work, I think, in very difficult circumstances during the worst of the weather, when there was so little interruption to the service. I think all the residents certainly appreciated that, and I think it'd be worth mentioning in the context of this report as well.
Folio holder.
I'd also put a shout for all council staff, but in particular Steve Featherstone's team of the street cleansing team. I think they really did do a fantastic service through the whole of the snow as well.
Thank you. I believe, unless there's any other comments, I believe we have finished paper B. Thank you, councillors, for that. Right. If we move to paper C, under the introduction, I didn't introduce the main speaker for paper C, Dr. Hugh Freeman, who's the chair of the North Hampshire Clinical Commissioning Group, which I believe is basically, we're all in it, it's us. So you're in charge of us on our medicals. There's a paper C here, which is quite detailed. We have the portfolio holder sitting in here as well, but I'll ask the doctor to introduce it as you choose.
Right, okay. Can you all hear me now? Yeah? So, good evening. I have spoken to this committee before, but I'll just introduce myself. I've been in Basingstoke since 1973 as a doctor, so I think I've got a fair experience of providing medical care in the community. And really, over that time, have seen, I don't suppose you can guess how many reforms of the health service, but it's about 26 major reforms of the health service. So here we are with perhaps the biggest change ever, and one that actually personally I'm quite excited about, because I spent my working life saying, I know we could do this better. That looks terribly wasteful to me. And now we've been given the chance. So I hope to just show you a little bit about what the reforms mean and what we're doing, and already I think beginning to improve the care that's delivered to the community. So what are these reforms about? Well, it's about clinicians in primary care coming together as a membership organisation, purchasing the health services for this population. Now, clearly, we can't do that together, so we need a team of very experienced health service managers to help us do that. We need public health to provide the assessment of your health so that we can then target health resources appropriately. And that's not just us, it includes nurses, professionals allied to medicine, and of course our secondary care consultants at the hospital. Just remember that when people talk about the health service, they talk about hospitals mostly. 86% of healthcare is delivered in the community. So really we've got to look at how the community is developed. Now, why have these reforms been brought in? Andrew Lansley brought them in, and he was looking at outcomes, improving health outcomes, reducing inequalities, driving up the quality of healthcare, and reducing cost. And at this point, I think I'd say to you that quality care is expensive, poor quality care is unaffordable. And I think we've seen that in mid-staffs and other parts of the country where poor quality has led to some pretty disastrous things. Now, the other thing to remember is under previous administrations, health spending went up by about 60 billion to something like 160 billion, and with no discernible improvement in health outcome. We have done some things better, but the basic health outcomes didn't improve. And that's the other tenet of these reforms. Chucking money at it didn't seem to solve the problem, so let's look at how we must do it better. So here we are in primary care, heart of the community, tying together hospital care, community care, and more importantly, all our other partners, so adult social services, the children's department in the social services, the voluntary sector, and many other partners that I think health haven't really tied up with very well in the past. It's very important that we do that now. So now, in terms of the borough, you can see on that map that we leave out a little bit of Whitchurch and St Marybourne on the left, and also have a bit of East Hampshire, Alton and Borden, and a bit of Hart and Rushmore, Hook and Hartley Witney. The reason that's happened is that these membership organisations, general practices, have developed because we in our area know each other, and that was the natural grouping for us in North Hampshire. So our population is 214,000. We have 21 practices. Hampshire Hospitals Foundation Trust is our main acute provider, of course now amalgamated with Winchester. We have Southern Health Trust providing our community services and mental health services. And the Hampshire Primary Care Trust has been split now into 5 clinical commissioning groups. So groups across Hampshire, like ours in the north, some much bigger, some about the same size. And I mentioned there the other things underneath that, the SHIP 8. So there's a recognition that some things are much better done locally. That's what we're about. But some things, like, for instance, disability, autism, those sorts of things, are better done at a larger population level. So we still meet as the Southampton, Isle of Wight and Portsmouth, Hampshire cluster, the SHIP 8. And now the newly formed Wessex 9, so that includes Dorset, and that's called the local area team of the National Commissioning Board. Okay, so when I did this slide last week, our managed budget was 288 million. It's actually reduced to 240 million. These things are changing fluidly all the time, and it's very difficult to get a grip. The explanation of that is we manage most services, but things like renal transplants, heart transplants, and the really complex things are managed by the National Commissioning Board. And the amount of money that they took off us has been altering on a sort of monthly basis while they work out exactly what they need for their services. So what is commissioning? Commissioning's a complicated process that I've split down here into some simple headings. I've already talked about analysing the health needs. Now that's really important. Public health, as you know, have gone into the local authority in Winchester, and I think that move has been quite successful. For me, that's full circle, because when I started, public health was in the local authority, and here it is back again. But they provide us with very important and updated information on all of our health, and the sort of thing for us in the north, our ageing population. We've got a bulge that other areas haven't got, so that means specifically older people's mental health and other things we need to concentrate on. So having got that information, we look at the pathways, complicated word, but if you have a healthcare episode, it's a pathway. Whether you go to A&E or your GP or you're referred on, it's a pathway. We want to make that as seamless as possible, because you all know that sometimes that actually isn't seamless and becomes quite complicated. We then draw up a service specification. That's relatively straightforward, and we do that with our managers that we have, that we've required from the primary care trust, and we've got some really good people. And then the long legal bit is the contract negotiation. We have to satisfy European law on these sort of things, because these are usually budgets over 100,000, and that has some complex legal things that have to be gone through. And procurement can take up to a year for a new service. Frustrates a chap like me, because I want to see it and get on with it, but you can't just do it like that. And then the very important bit that I think, as a large organisation, the health service hasn't done very well, mid-staffs, Cumbria maternity, is the ongoing assessment and monitoring of quality of that service that you've just procured, to make sure it's delivering what you wanted it to do in the first place. So we've got plenty of pressing challenges. The resources are an issue. The health service budget is said to be ring-fenced. It's actually reducing. My own view and take on that is that we have a bucket load of money that perhaps we haven't used as wisely as we should. And I think that I'll describe later how we've already made some significant changes, improved the quality of the service and reduced the cost. People's expectations, the personalisation agenda, they're rising all the time. The demand and need. Quality is very, very high on our agenda, and it's very important for us to assess the market. And then market sustainability. I think in terms of care agencies, the market out there needs to change, because the complexity of people's problems is increasing all the time. People are getting older, living longer, and as they do, they get more and more complex. Probably 3 or 4 conditions at once, and that needs close monitoring if you're trying to look after them in the community. We always look at inequality at this stage, so we just need to be certain that everything we look at looks at that area. I mean, I was fascinated by your debate about rough sleepers, and at Bramley's Grange in the old days, we had one who wouldn't go from the shelter outside, slept there all winter on an old mattress. However we tried to help him, he wouldn't actually take any of our help, and was always back there the next night. So I think there's an issue of whether they will take it, but equally we need to make sure we are providing services in that sort of situation. So just as we've got financial pressures, Hampshire County Council they've made 100 million savings already. Their next target is another 100 million. So in terms of health and social care, we've got constrained budgets. We really do need to work together. And one of our big projects in the north is our integrated care. And I'll talk a bit about that in a minute. So just to tell you about our structure in our clinical commissioning group, because you might like to know about the sort of governance of the way we've set up this membership organisation. And there you see the main bodies within our organisation. So we have the governing body, which is responsible to the membership senate, that's the GPs, and the clinical cabinet, the working people within that. And underneath that you see the various boards that we have. And then there we have the governance described with the Integrated Governance Committee, the Senior Management Team, and Stakeholder and Communications Committee, which is really important to us because what we've already set out to do is to ask our public about any new service that we're going to design and ask for their comments before we actually go forward with that. So we also have a Performance and Insurance Working Group, Clinical Quality Working Group, and then Audit and Remuneration. And then we're also responsible to our population and the National Commissioning Board. So it's quite a straightforward, you could see who's responsible to who. Now within the architecture of Hampshire, you'll see that along the middle there in the pale yellow are the clinical commissioning groups. And around that, the whole of the architecture of Hampshire and all the other services and providers that there are. Hampshire Link, Become Health Watch on the left there, the Borough Councils, the Health and Wellbeing Board. Now, the Health and Wellbeing Board is a statutory body of the County Council and assumes great responsibility for overseeing the provision of health and social care across the community. And I've been involved in that right from the beginning and just been elected vice chair of that group. And I think it's interesting that it has on it representatives from Borough Council, just 2 of them. And I hope and think, and I hear from Marion, that in fact they also have a forum so that everything is disseminated around. See Kathy nodding. So in this new architecture, it's how do we all communicate, how does information get out, how do we make sure that everybody knows what is going on. So working together, I think, is terribly important. So what are we doing currently? How are we involving the public? How can we build on our current practice and improve the outcomes? Do we need radical change? There are many people who said, do we need this radical change? Couldn't we just do the collaborative working before? Well, in the last administration, we had something called practice-based commissioning, and I was really excited about that, and we tried very hard to change things, but it was impossible to get the Primary Care Trust to move in anything other than slothful pace, and I hope we will be able to make big changes. The resource issues won't go away, so we have to really be homing in on that. And I'm absolutely certain it's better working together collaboratively than the silos that we have been working. And we mustn't forget technological innovation. In our obstructive airways disease patients, and these are people who are often very unwell, we're using the innovation of them being able to measure their oxygen levels at home. And we've proven that people are much happier about knowing where they are in terms of that, because it's a key fact that we need to know. And also it's reduced admissions to hospital because they're much happier about when to ring, and they ring early for advice before they become more unwell. So it's just one area where we've used innovation. So the slide that's unreadable, you might say, what is that? That is one patient. And that is one patient's care over a year. And you can see the writing on the right gets thicker and thicker. So that's one patient, and that's the number of people that were visiting that one patient home. So at the right-hand end in December, before she went into hospital, she was being visited by 25 separate agencies, all at different times, not necessarily talking to each other. Complete disaster, complete waste of money. And that's the sort of thing that we need to really, really sort out. So the facts on that slide are irrelevant, but it gives you the idea of the sort of thing that we have to get into. So, our success. I knew right back at the beginning that the care of our elderly in the community needed sorting out. I often do hand-stock shifts, often go out and visit people and think, oh my goodness, how am I going to keep this person at home? I wish I had this and I had that. And what we have identified is a tool that brings up the people who are most unwell, and you can then prioritize their care. So if you give this list to doctors, they say, I know that person, ooh, I don't know that person. So this tool that we use identifies more people than we know who are in need of proactive case management. So if I tell you that we've reduced our emergency admissions of unwell elderly people by 4%, it sounds okay. But if I tell you that's against the rest of Hampshire going up by 6 and 8%, then that's quite considerable. And by proactive case management, getting case managers involved, proper care, proper equipment, we'd be keeping these people safely at home, which is where they all, 76% say they want to be. And in doing that, reduced the cost by 1.6 million already. So that's the sort of thing where we're really making strides. And the way that we've done that is by getting teams together of nurses, GPs, and importantly and crucially, social workers, older people's mental health, in groups of 2 to 3 practices, looking at these cases on a weekly basis and making sure the care is proactive, not reactive. I've worked all my working life in a reactive health service. We need to make it proactive. And I think we've already got evidence that the approach that we're taking is working. And that just shows you the sort of makeup of our integrated care teams. For reasons that I can't remember, they've all got names of trees. But they are actually there, and you can see that they're the access to other services, and we hope we're talking about what we call step-up beds, so not necessarily needing hospital, but say that somebody's really unwell and the relatives have been coping but can't, and the carers can't, then perhaps they need to go into a slightly better nursed facility for a short time just to turn things round, rather than a hospital admission. I'm a firm believer that the acute hospital needs to be for people who are acutely ill, who need specialist services, maybe surgery, maybe general physicians, and should be kept for that, and not just somebody who's failing because they're just a bit unwell. And we are able to do this in places like Orton with the community hospital, and Odeon, where we've got this integrated care team really up and running well. We're doing that in the community. And that just shows you the distribution of our teams throughout the patch. This slide, just another to show you the work we're doing. This is my colleague Nicola Decker has won a national award for her dementia pathway. And I think it's really important because what it does is it identifies all the various services and people involved with people with dementia, and how actually you need to bring them all together so that we all know who needs to be involved at what time. And, you know, for instance, if somebody with dementia is being kept at home, they've got their proactive case management, we need South Central Ambulance Trust to know that that's going on, so that if somebody dials 999, they can see that there's a case management plan and who they should contact, rather than just shipping them into hospital. Because people with dementia, on the whole, don't do well in the acute general hospital, and they're much better cared for in the community, provided that's still appropriate. So this is the sort of work we're doing in these important areas. And this one swings quickly to children. It's a very complex slide, but that just shows you the enormous work we're doing with children's services. I don't think you'll be able to read that, but there are many pathways, right from birth at the top through to child and adolescent mental health services, children's centres, and then the really exciting project at the bottom where we're getting young people into our organisation, mentoring them for 6 to 8 weeks, and we're evaluating what they think about the services provided to them, and then trying to get some output out of their views. So we've got a lot of interesting new work going on. We've already got some improvements in outcomes, but there's a lot more to do. That's just a brief snapshot of some of the work that we're doing. Any questions?
Councillor James, I believe.
Thank you. I've got lots of questions, so I've got about 20 questions, but if I could just start with one of the things that you spoke about tonight, which was that you talked about that there's been a... Sorry, I wrote it down here. You talked about that there's been a reduction in your budget of £44 million. That was from yesterday. I guess that's from the budget, is it? That's my first question. And how will that impact, I know you can't answer this yet, but I mean, on your presentation that you've given us tonight, have you thought about where those cuts are going to be made?
I probably need to explain about the allocations in the health service because it is mightily complicated. There is a formula by which health money is distributed around the country. We are number 4 from the bottom. We get £960 per patient per year for health delivery against the top level of somewhere like inner city Manchester of £1,500 per patient. And that's mirrored at the local authority. It's a similar allocation. We're considered to be healthy and wealthy and therefore not needing it. So there's no recognition of our aging population and that old people become really unwell and need complex care. The allocation formula is being looked at, but of course it's very politically sensitive and I'm not certain when it's going to be looked at. So that's part answer of how the allocation is made. Now the second part of this answer is that the disaggregation of Hampshire, 1.6 billion health funding, was very difficult. Add into that the complexity of trying to strip out the specialist commissioning, and it gets even more complicated. So that's why the figures are changing. I don't think we need to talk about cuts. I think what we need to do is wait for a year for this to bed in, because the chief finance officers of the National Commissioning Board are working closely with us, looking at where these shifts and balances should be. So it's not as if it's a budget like yours, which you would have to make cuts if it was cut. It's about how the whole thing balances out. But that's why our figures are changing on a weekly basis. So I'm not making cuts to health provision. What I'm doing is redesigning services within the budget I've got to try and make them more efficient and better.
Thank you. In relation to the allocation formula, on page 49 of 113, it talks about there are a number of conditions where rates in Basingstoke and Deane are generally worse, and it names those, and then goes on to say about our ageing population, but it also then talks about there is a significant difference in prevalence of life-limiting conditions, and it talks about in the areas of deprivation that men are likely to live 5.5 years less, and women 4.4 years less. And I just wondered, in relation to that allocation formula, does Basingstoke get a bigger slice of the pot?
No, it doesn't. I mean, that's the point. We've made representations to the Department of Health and to the Health Minister saying, I'm sorry, your allocation, your formula is wrong. If you look at our elderly population, interestingly, just to change the subject slightly, in the deprived areas of inner cities, they're mostly young populations. Young people on the whole don't get cancer. All right, old people get dementia and cancer and other diseases, so they are more costly. So the formula's not right, but you can't change this overnight. And certainly we've made these representations because to my knowledge, our allocation has always been wrong. In a big place like Hampshire, you can hide it because you can slur money around, but once you get down to a small area again, whoop, up it comes, you've got a problem. So we're on the case as much as we can be, but we're not getting more for... That information comes out of the Joint Strategic Needs Assessment, so we're well aware of that, and most of the work we're doing on long-term conditions is looking at all of those issues.
But yeah, and some of those that are listed there are not long-term. Some of them are in relation to, and they're across the age sector. So, you know, we talk about teenage pregnancies, we're talking about obesity in children 6 years. So it ranges a lot of things. And my concern in a wealthy area like Hampshire, if we're talking about this strategy of yours, we're not going to have the money because there's no money that's going to follow. This is what the report is telling us. This strategy. That concerns me in relation to that allocation. That's one of my questions. I've got lots.
Okay, well, in teenage pregnancy, we're doing rather well. Actually, the rate is reduced quite dramatically with the work that we've already done in a partnership way with many organisations. And I've just this morning been to the local children's partnerships to do a presentation and had some really good opportunity to see how we can work together on childhood obesity. So I think I think you mustn't. Obviously, we're concerned about our allocation, but it isn't going to stop us doing a lot of good work to improve all of these things that we know that we have to work on. I did say it's a snapshot, but we are under this. We know all of the things that you've mentioned, and we are working on all of them. But excitingly working in a much more collaborative partnership way, which I think is going to produce the results. And we'll come out with, from the conference this morning, there'll be a bit of a strategy developed from that, and we've got some really good ideas about how that will develop.
But can I, just to put people aware, I don't know how many people are aware, there was a conference this morning at the Apollo, which I believe you were speaking at, which I believe our officer was also there, and also you wanted to actually say something tonight.
I can do very briefly. Yes, the conference this morning was the local children's partnerships, and it was focusing on the needs of children and young people in our borough. But Dr. Freeman also put the health context into that conference, which was very helpful. In terms of further information for tonight, I do have another couple of slides that relate to the Hampshire joint strategy and the draft health and wellbeing strategy for Basingstoke and Deane. I don't know whether the committee would like me to run through those, but you do have the information in the report and the appendix that were attached to the report. So in view of time, it's entirely up to you whether you would like me to go through those in addition to the questions and discussion that you're now having with Dr. Freeman.
Could we just have a general hands up if we'd like the officer to go through those?
I read them and I have questions in relation to them. So,
if it's practical, could you please go through them? Yes.
Thank you. It's just to follow up the context that Dr. Freeman has given you in the terms of the health reforms. What I can just summarise very briefly is the joint Hampshire strategy that sets out the priorities of the Hampshire board, and talk a little bit about the Basingstoke and Deane context. So the shared plan for health to improve health and wellbeing in Basingstoke and Deane, which is a document setting up priorities of the local health and wellbeing partnership, and which we're asking you for comments and to endorse tonight. I won't elaborate further on the health and social care requirements. I think that's been outlined quite extensively earlier. Moving on to the joint health and wellbeing strategy, it is a requirement that the Statutory Health and Wellbeing Board produces a document setting out priorities for the county, and the aims of the strategy are clearly identified there. There are 4 themes that have emerged through the consultation on the strategy. Starting well, so every child can thrive. Living well, so people choose to live healthier lives. Aging well, so people remain independent into their old age and have choice and control and timely access to high quality services. And healthier communities, so people live in strong and supportive communities. And the County Council, which is lead on this, has asked for every district council and partner to endorse this county strategy, and that's one of the things we're putting through to you tonight. But leading on from that, we're very keen to make sure that we engage and interact and get involved at a district level. And I think it's important to recognise that this council can contribute to health outcomes across a range of its services. So even through our planning and environment services, through housing, and you've heard earlier about some of the potential health issues around our housing response, certainly through our leisure services and interaction with our voluntary sector, clubs and sporting organisations, through to licensing and our involvement in our local health and wellbeing partnership. And through that influences some of the health promotion work that we can do as a borough council. Highlighted particularly some of the areas where we do have health priorities, but on the whole, as has been explained, in the borough, our health is generally better than the England average. But where it's worse than the Hampshire average, that's where the partnership has decided to focus its activity. And you've rightly identified some of those issues. Obesity, teenage conceptions, binge drinking, some of the issues around smoking, the consequences of diabetes, and some cardiovascular diseases. We've also highlighted the pressures that will be put on by our ageing population, and we need to address some of the inequalities across the borough. So our local plan has been developed by the Basingstoke and Dean Health and Wellbeing Partnership, focuses on our health improvement activity through collaboration, is evidence-based, so it's from the information from the Joint Strategic Needs Assessment and local health profiles, and sets out the actions for the partnership to contribute to improving health outcomes. So for the borough, the partnership has identified the priorities as being reducing lifestyle-driven premature deaths, illness and disability, focusing on our ageing population, and looking at issues relating to mental health as key areas of conditions. But we've also expressed how we want to do the work around those conditions. And that will be by improving outcomes for our most vulnerable residents, particularly in our neighbourhood renewal strategy areas, supporting action through communities, so companionship and local decision making about activities that go on in communities, and trying to increase personal responsibility for health and well-being, helping people to make informed choices about what they can do to improve their own health. So the actions for the Health and Wellbeing Partnership to support those objectives are focused on delivering targeted support, looking at programs where specific populations or specific geographic areas have a prevalence of people who are vulnerable to a multitude of health risk factors, and we will look at those. We want to support self-help, so working with local groups to enhance peer support in communities, to help people to help themselves within communities. And finally, to promote universal awareness, the universal services, primarily through better communication, making sure that information that is already available is delivered and accessible to people. So those engaged in delivering our services, but also those people who need to use our services know where to go for the right information. So it's not a strategy for the Borough Council, it is a partnership strategy which aims to add value to the core activities of its constituent partner organisations. And what we're asking you tonight is to comment on that, and if you can endorse that so that the partnership can go forward and develop its action plan to achieve those objectives. Thank you.
Thank you. Councillor Mrs. James, I'll revert back to you.
Thank you. I was just asking Dr. Freeman, you talked about case management. Are you saying that everyone with dementia or Alzheimer's will have or has a case manager, or is that the intention?
No, not everybody will need that, because in early dementia you can be cared for quite easily at home without that. But when you become more complex, you might have heart disease, dementia, and one or two other things. And so when there is a complex problem, then the case is managed, and that comes into the integrated care team.
My other question was around, and I support this, is keeping people at home. Is there the resource to do that, to keep people at home? I know it's cheaper to keep people at home than put them into a nursing home, but resource as in the availability of carers to do so.
I think you heard me say that we'd already reduced spend by 1.6 million by doing this, and we've got some really, really good evidence from people in this situation who think what's been going on is very good, because we're surveying them all the time. So I hear your skepticism, but I think at the moment what we have hasn't been used well. I mean, our community nurses have been going around taking blood, changing dressings. Actually, they're far too skilled to be doing that. We need to look at appropriate people for appropriate tasks, and community nurses need to be doing more complex jobs. So I'm not sure that the way the workforce has been used has been well sorted, and this is the sort of area that we're looking at. But you know, if you can reduce the number of hospital beds, then you can bring that resource out into the community. And if you read what Sir Bruce Keogh is talking about in terms of the reconfiguration of acute services, it's precisely what he's talking about. You really should only be in hospital if your leg's chopped off or you've got something really serious going on. And it shouldn't be full of elderly people who are just there because actually there's nowhere to look after them. Now, what you need to do is have proper care in the community. You'll need residential care. You'll always need residential care. But the way it looks at the moment, I understand your skepticism about the amount of resource being available, but I think if it's reconfigured, we'll manage to do this.
My skepticism is really in relation to, we get people out of hospital or get them out from the medical diagnosis into, and it becomes a social problem, and then there'll be lots more people at home, which I support. But what I'm asking is, it then is not your budget, I guess. It then becomes a social services budget, and my concern is, and it's things like changing someone's commode or putting them on the commode, or then what happens?
The answer to that is that you need to see this develop. If I said I've been reactive in my health service all the life, we have to continue firefighting, reacting, while we're building a proactive service. So we've got to double run. That is not straightforward. But if we get it right with the proactive case management, you should have much less firefighting to do in the future. Pull back another 10 years, supposing we get everybody's obesity sorted, the diabetes will drop like a stone, heart disease will drop. Remember, when smoking in public was banned, heart disease fell off a cliff. Absolutely, within 2 years, everybody was amazed, but it actually fell off a cliff, dropped by something like 45%. So you've got to remember that sort of proper interventions do make a huge difference if you target it correctly.
I've
Sorry,
three speakers that I need to move.
I know, but
around.
sorry, you didn't answer my question, Dr. Freeman. What I said is, if we take people out of hospitals and from the acute side of treatment and they go home, is there going to be the resource then to put them on the commode or to wash their faces or feed them? My experience in the community is that's not the case, and it becomes someone else's budget. And have you looked at that in relation to the work you're doing, and who's going to pick up that work? And the experience of the carers that we have experience of is that there isn't the resources there for them to do this work.
Councillor, I'm going to have to ask for other people.
No, I'd like an answer to my question.
We have limited time. We have a professional
Why,
here.
why do we have limited time?
Because I have other people wanting
I
questions.
know, but what,
I
I'd
will
like
come
an
back
answer
to
to my
you.
question. No, I'd like an answer to my
Councillor,
question.
you have voted me in as chairman. I will go round
I
the
didn't
floor
vote
to
you
other
in as
councillors.
chairman. I did not vote you in.
Fine.
I'd like an answer
That's
to my
not relevant to
question.
me.
There's no point in being here then if we're not
That-
going to answer the questions.
Your
is there?
decision. I'm going to Councillor Baker, then Councillor Waldridge, then Councillor Bierman. Councillor Baker, please.
I have two questions, and I'd like to thank Dr. Freeman for his presentation, which I found very interesting, and I'm hoping that it might be possible to have copies of the presentation. Thank you. Outside of dementia patients, with the issue of the ageing population and more complex needs, does that also then raise issues about data and information sharing? And I wondered what thoughts the Clinical Commissioning Group might have on that. The second question, which is not connected, is at the moment there are centres of excellence, either nationally or regionally, and outside the boundaries of the county. And I wondered, are we confident that we can still retain those centres of excellence?
Information governance is difficult and challenging. Caldecott 2 has potentially made that more challenging. We have been told that we're not allowed to have patient identifiable data within our clinical commissioning group, which potentially makes things very difficult. But there is something that we can use. If you're using patient identifiable data for performance management, we are not allowed to hold it. If we're using it for clinical improvement and clinical pathways, then we are. So actually, I think it won't stop us from working on the sort of work that I've been talking about. It is causing difficulties where we want to share work with South Central Ambulance, for instance. It's really important that when paramedics turn up to a house where there's a complex case, that they can come armed with some basic information about the conditions that person has, because very often they make a decision to transfer because they don't know what's going on. And paramedics these days are incredibly skilled and are often able to make a sensible decision if they know more information. So we're working through that as we speak about how we get through the governance issue so that it doesn't slow us down in the way that we want to transform services. But on the face of it, Caldecott 2's caused a problem. Your other point, you are entitled to be referred to Timbuktu, if that was in England. No, you're entitled to be referred to anywhere where you want to be. That is part of the constitution of the NHS. So that if you decide that you want your hip replacement done in Manchester, you can be referred.
That wasn't actually the line I was coming from. Where I was coming from was that at the moment there are some hospitals that have specialist teams who either provide a service on a regional basis or perhaps even a national basis. And it was where the resource was going to come to ensure that those pockets of excellence are maintained.
Well, that's really the remit of the Specialist Commissioners and National Commissioning Board. I mean, that's the reason the money has been divided like that, so that those centres are maintained. So, yeah, absolutely. So heart transplant, renal transplant, some of the more complicated oncology for cancers, we have Southampton as our regional centre for that. That will continue. So yes, no, that is protected.
I've finished.
If I could very quickly come back on this data sharing, it's a previous attempt to try and make patient health information available to whomever needs it at the time of a health incident occurring. I can recall patients being asked to sign up to agree that their data could be shared. And at the time, my own reaction is, if that means the ambulance crew have got all the information they need when they come to pick me up off the road or whatever it is, then great. But does that also mean government has got access to the data? And I was told, yes, it did. And so I said, well, sorry, no, they can't have it. And so that's the, I think there is there's a almost philosophical issue there about data and personal data and who has it and for what reason.
It's really difficult. The National Summary Care Record is coming back again. We are actually mandated to sign up to it whether we like it or not in our clinical commissioning group. Now that will hold NHS number, it'll hold your basic details, so name, address, date of birth, it'll hold your allergies and your medication. So that the theory is that if you turn up at Manchester with a broken ankle, they can access that. So that's the national scene. I think what you're referring to is something we all in Hampshire find very, very useful, is the Hampshire Health Record. And most acute hospitals subscribe to that, and most of us do in general practice, so that when we look into the Hampshire Health Record, we can get latest information about what's happening to that person. Because sometimes discharge letters don't come from Southampton very timely, we can get the information much more quickly. But not everybody signs up to the Hampshire Health Record, and I think that's probably what you're referring to. Now, can government get hold of the Hampshire Health Record? I don't think they can get hold of that.
Can we Councillor Waldridge and then Councillor Bierman?
Thank you, Chair. Question for Dr. Freeman and then one for Marion, if that's okay. Firstly, I'm going to quote something you said earlier, if that's okay, Dr. Freeman. You said, I think this is right, the health service budget is said to be ring-fenced. It's actually reducing. That's, as far as I'm aware, contrary to what the central government is saying, but can you comment a little bit more on that, please? Thank you.
They're able to tell you that they're increasing it by 2.6% because that's effectively what they're doing, but the actual amount of money available within the health service is reducing. So it's a political fix, if you like. We get 2.6% raise this year, but 2%, or the hospitals will have to make 4% efficiency savings, and we have to hold 2% for extraneous purposes. So effectively, we are working in a reducing budget, as are everybody, as is everybody else.
Thank you for your honest answer there. Sorry, one more question to you and then one to Marion, if that's okay. I can recall about a year ago that there were concerns about the CAM service and the waiting list for young people on the CAM service. Are you able to comment as to, if you don't know, please tell me, but if you've got some idea about whether that situation has improved, I'd be grateful to hear from it. Okay, thank you.
The CAM service was re-procured, as I think you know, and the new service is beginning to deliver. Now, one of the issues with the CAM service is that everybody was being referred to it, behavioural problems and other things. It is an adolescent mental health service. So it's specifically only people with mental health issues should be referred. So what was happening was schools with difficult children, behavioural problems, were all referring these in to the CAM service. That isn't appropriate. So it's about actually how do we manage these other issues, and the paediatric patch teams and other services are dealing with those issues. So we're beginning to sort out the correct pathway for who should go to CAMS, and I think the service is beginning to improve. That was one of the bars across my paediatric thing, was us working very closely with the CAMS to make sure that that service is available to young children, adolescents with mental health issues. So it's very high on our agenda, and I think it is improving.
Just a supplementary to that, if you may. You mentioned the part, the reason I fully equate that, I used to work for Connections, and I know when the service went, that service could were no longer dealing with a lot of those issues you just mentioned. But do you think, where are those, which agencies are now dealing with those sort of issues which aren't specifically mental health now, given that Connection Service has gone, and a lot of sort of counsellors, etc. in schools there aren't as many of those as there used to be?
I think the school nursing services are the first line, and they're definitely in there, and then the paediatric patch teams, and then building on that, the triple P parenting services. There are lots of things going on in those areas for behavioural issues, and the children's centres are heavily involved. So there's a network of services that are involved in dealing with these issues. And in the old days, most of these were just pushed at CAMS, and of course it wasn't appropriate for that service to be dealing with those issues.
And finally, to Marion here, it may be me just not reading this properly, but if I can take you to page 49 of 113 on your report, if that's okay. Sorry, I'll just get it myself. You've raised the number of conditions there, which, I can see that. What I don't quite get is the priorities that you've then, well, not you specifically, but are then there to deal with those, don't seem to necessarily go hand in hand with the concerns that I've raised. And I just wonder whether you could explain a little bit more about how you reached these priorities given the conditions you've got, because that's what I'm finding quite hard to understand here. Thanks.
Thank you. Yes, the priorities that have been identified in the shared plan are those that the partnership as a collective feel that they can best address with the resources they've got. It doesn't mean to say that there aren't agencies within the partnership that are addressing these as part of their core business, or indeed that other partnerships or service providers are already dealing with them. What we're saying is that these are the priorities for the borough, they're the characteristics of the borough. And yes, they do need to be addressed by somebody. And in most cases, there is a lead organisation. The shared plan identifies those actions and activities that the partnership as a collective can best address. So while they will be much the same, they're not addressing every single issue that we know is a problem. And there will be other avenues where those issues will be addressed.
Councillor Bierman and then Councillor Peach.
Thank you, and thank you, Chair. Dr. Freeman, firstly, I'm delighted that you are enthusiastic about the new arrangements. I hope that stays the case, if it's the right thing. I mean, I, as a layperson, keep on trying to follow the latest iteration of how health service is going to be delivered, and just as I think I'm getting a rough idea, it changes, and I know people in the service who've given up because of the many changes and so on. So you deserve an award for that alone. Couple of things. The first is just coming back to the point that Councillor James was pursuing before she left. I think what you were saying was from the health side of things, you're looking at how this service provision can be made more efficient. Would it be fair to say that from your viewpoint, and you might be reluctant to say this in this company, but that the difficulty lies with what the local authorities are able to offer in terms of service to home care? Because it does strike me that as you said in your remarks, aging population and the sort of things it's bringing with it, it does mean that if you're going to have home care, you've got to have a lot of support. And from every report I hear, certainly listening to various radio programs, there's constant reference to the fact that the support services in the home, usually from the social services, is not performing, not least because the carers don't get the time to do what they need to do for the patients.
I think that's the most important point, that we're working very closely now with the local authority. I think there's a win-win situation here. So we need to look after people better, be proactive, and keep them healthy and independent for longer. So the win-win is that we do that and they are happy and have good quality lives and don't have to whiz in and out of hospital. And actually, the residential care requirement that the local authority has to pay for reduces. Okay, so the very important thing that we're developing in North Hampshire is the appropriate use, and the personalisation agenda actually fits very nicely in this. And the local authority are aware of the need for quality services, and I talked about complexity and whether the market was up to this. So they're developing the market really as we speak in terms of getting the right organisations to deliver this care. What you always hear are the bad stories, and the press is littered with bad stories. But you ought to go onto our website, the North Hampshire Clinical Commissioning Group, and look at some of our films that we've made of some of our integrated care services that have been delivered, and I think you'll begin to see what we're trying to achieve. So it's no mean task to do all this, but I think it's achievable, and I really do understand why you are listening to the press and the media saying, you know, it's terrible, they can't deliver it, they can't spend enough time. I think it is possible, but just in the way that we need to change maybe the job that the community nurses do, because they're very skilled people. Should they be doing what they're doing, we have to look exactly what carers are doing and who they should be. So the whole thing needs a complete redo.
Well, it's obviously not going to be an overnight solution there. The other thing, just quickly picking up on your remarks about Southampton being the ongoing regional oncology centre. I am not unaware of activities by Merv Rees and other facilities in the north, which will, I hope, mean that that is a centre. Now, I don't know whether this comes within your scope of thoughtfulness and activity. My concern would be if this wonderful new centre, which I welcome and in another capacity have supported massively, if it were somewhere out in the sticks that's inaccessible, because I think as much as giving good care is important, access for relatives and indeed users, and access by public transport, if I may say so, is not unimportant, and I hope that whatever happens there will mean that public transport access for all is of a high standard.
I should have mentioned we are, of course, going to get a radiotherapy centre and an oncology centre in North Hampshire, and it's long overdue for poorly people to travel to Southampton for radiotherapy on a daily basis is a complete nightmare. So having that centre up here, slightly different from Merv's Cancer Centre, but it will be complementary. You've also touched on the reconfiguration of Hampshire Hospitals Foundation Trust and what they're proposing. You really do need to read Bruce Keogh's report, because he is quite clear that we have too many acute hospitals in the country. And it is quite clear the intention is that people will probably have to travel. I think what we need to do in the light of that, and I'm not saying how the reconfiguration in North Hampshire will happen because I don't know, but I think it's quite clear that what we need is therefore our local authority partners to look very carefully at transport and how that works, because not everybody will be able to use a car. We need proper transport to these regional, super-regional centres, and I think that's going to be increasingly important. I don't know that it's sustainable to have top-class services everywhere that you want them, and the reason for that is you want your specialists to be doing hundreds of that operation, and they become very good at it, and there's very clear evidence of that. The old-fashioned way that I grew up with, Bill Heald, doing a bit of vascular, bit of guts, bit of this, bit of that, because he was there, he was very good at it, but survival rates are better when you've got a vascular man doing your arteries, a bone man doing your bones, a gut man doing your guts, and so you need many, many more of these people, and they all have to be in one unit where they can work together and work off each other. They can't be separated around, and that's the issue. That's the Bruce Keogh issue, and that's why I think we are going to see centres further apart, and where transport then becomes really important.
I'm heartened to hear that it is part of the consideration and a serious point, because I think it's a massively important one. Thank you, Chair.
Thank you. All those councillors who are on the P&I should bear that last comment in mind. Councillor Peach.
Thank you, Chairman. The question really is, I had a conversation recently with a neurologist with regards to, for example, remitting, relapsing multiple sclerosis, and he was very open to complementary treatments in terms of vitamins and supplements, and felt that perhaps more expensive treatments were equally as effective or ineffective depending on certain cases. Wasn't carte blanche cross door, so I won't say that, but that was the general principle. And if something's working for that patient and that was managing their symptoms for them, then that was the best approach to go down. And also considering the tight budgets you've got of, particular treatments might cost 35,000 per year, perhaps. I might be wrong with that, whereas vitamins and supplements might be £1,200 a year. Is there a way that the strategy can support such measures of patient choice?
You're talking about a specific disease there, and that neurologist might be slightly out of line with national thinking. So we would have to take NICE guidance really on what NICE say is the correct treatment for that disease. So probably I might have personal views about that. Just remember our local budget for prescribing is 26 million for North Hampshire Clinical Commissioning Group, and that has to encompass everything that you all require. So I think for that we would be following NICE guidance on the correct treatment for relaxing, remitting multiple sclerosis, and I probably couldn't in this arena go outside and say what I personally thought.
No, thank you. I mean, it was really just a sort of as a specific case or a specific illness, but it was really just to recognise, maybe not this time round, but maybe as thought processes change in time, perhaps that's something that can be taken on board. The other question I wanted to ask was with regards to the link into housing, and I was fortunate enough to work on some extra care schemes in the past, where the housing provider was very keen to put in as much high-tech equipment as they could and to provide facilities for GPs to perhaps be on site as satellite surgeries rather than old age pensioners trying to find their way over to surgeries. And some of the link line machines that are on the market are really interesting insofar as a patient could perhaps check their blood pressure and send that to their GP without having to come into surgery. And from that, I was just wondering, again, from the strategy, is that something that's going to be built upon?
No technology in there. I mentioned the oxygen monitors, but you're talking about blood pressure monitors, blood sugar monitors, the whole 9 yards, really. And there's very good evidence that the correct use in people who are properly trained, it's very beneficial. But yes, that's coming.
Councillor Leeks.
So soon. Well, I'm pleased to say, or I'm not so pleased to say, I don't know whether I am or not, that certainly by a neighbouring authority, health authority, that the midwives, who I'm married to one, at the moment, no, not at the moment I'm married to, that they used to, years ago, and I'm certainly sure when Councillor Osterton was a midwife, that they used to have to visit the ladies 12 days after birth or whatever. Now, they very, very rarely get a home visit because they're all sent off to these centres. So, as a husband of a midwife, I think it's a bit better because I actually see more of my wife. But so it's already happening. And I totally agree. We always hear about the bad side of the NHS. There is a good side. There's a fantastic side. They've done me proud. And yesterday, no, it was the day before yesterday in the Daily Mail, it said in one of the letters pages, it thanked one of the GPs from Tadley, which I live in, for his continuing support even when her husband passed away, and he actually had finished. He'd taken another position. So yes, I think it's a fantastic organisation, National Health Service. Yes, they get it wrong occasionally, but I'm all for it. And I also think, you know, if it can make it any better, any cheaper, great. I could go back to sleep now, can I?
I think it's a very, very special resource that we all need to look at how best we protect and support. And I think one of the big bits of work that I'm really excited about is coming from Basingstoke, where your community development officer is developing a plan with one of our local areas and doing it in such a way that makes the population own it. And I want to get in there with her and do some health work so that they can own their health and be more proactive, because there's no good a guy like me saying, you need to do this and do that. People just say, And it's about how do we engage people to really take notice and make their own changes to improve their health. And I think that's the way forward. It's a completely different way than the way I was trained for, but I can't wait to get in there and try and do some of this work.
Councillors, thank you for your patience. Now, are there any other questions? You're very welcome to stay. We're going to move into discussion of the paper.
Just one final word then. Please remember that many, many of us were involved in the development of the Hampshire Health and Wellbeing Strategy, public health, the public, many consultations. I think there were in excess of 2,000 Health Watch links before Health Watch, everybody involved. And what Mary and I on the local health partnership with Kathy have tried to do always, interestingly, 2-3 years ago, we came up with a lot of this locally because a lot of it's common sense. But where we got frustrated was how do you actually, with no funds, deliver any of this? So that was the difficulty. So it's about partnership working, and I hope you do support this paper. By all means, have a very healthy discussion. And I have seen tonight how you are able to have very healthy discussions. And I hope, as I say, that you support it. So thank you very much, and I will take my leave, Stephen. Thank you.
Well, thank you very much for coming in for your third visit here, I believe. And appreciate you coming in and giving us information. Thank you. Councillors, we're still on paper C. We're now into the discussion part of it. Oh, do we have any speakers? In which case, the recommendations are on page 18 of 113. If we look at this 2.1, 2, 3 and 4, 2.1, we note the presentation. And I wanted to clarify with the officer that that presentation is available to us, actually. I've had clarification that presentation will be available to us and will be emailed round, which is what I think we've been asked for. So that's 2.1. Are we going to go through them separately? Yes, yeah. So that's noted. Are we happy with that? 2.2 supports the Hampshire Joint Health and Wellbeing Strategy. Great, thank you very much. 2.3 comments on the draft shared plan to improve health and wellbeing in Basingstoke and Dean. So that's more specific to us. We Councillor Baker.
Thank you, Chairman. I think that rather as Dr. Freeman said earlier, that a lot of the draft is applied common sense. It's clear that there are issues that we need to deal with, and this is looking at how we deal with upcoming issues for our future health and well-being. I would like particularly, though, to draw attention to a paragraph I can't find in the report, but somewhere there is a figure of the budget that we have that supports this, that I think is about £8,600. Five page, is that a page number? The page in the report, 5 of 7.
Bottom of page 22 of 113. Yeah.
Yeah. So it's only to say that, you know, that in many ways I wish we had more resource to put behind this, and I don't know whether that's shared by others in the room, but whether we could, if that is shared, whether we could send that message back, that we think the aims are great and wish we had more resources in order to try and achieve them.
But I just ask if anybody wishes to speak against that, because well, let's just, does anybody not wish to see this figure raised? No, yeah, you have the whole committee behind you on that. Thank you. Did you wish to raise anything else, Councillor Baker? Thank you. Because that does bear on to what Councillor Bierman was saying earlier, where you have health in the community and that, which is what, yeah, so it's all tied together. Through the questioning that we had, and quite severe questioning at times, I believe the comments, I'm looking at the officer, have you actually got comments for this? Right, we would like a few more comments, please, else the minutes are going to be a bit... So let's have some more comments, please.
It's the comments as the view of the committee that I need to record. So officers have taken away individual comments and questions that were made. As usual, this part is about the view of the committee. So we've already got Councillor Baker's suggestion that the budget needs to be increased, endorsed by the committee as one comment.
Yep. Councillor Bierman, would you like to just put the transport issue in some sort of area and see if we've got general support?
Wow. Yeah, I mean, the thrust of it is that where health provision is given, and particularly where centres are being developed, the importance of access to such locations by means of public transport should be a vital component of the considerations.
Thank you. Does anybody wish to speak against that? In which case, that's the view of the committee. But Councillor James, do you want to add to it?
I'd like to also say that I think it's important to note here that we have a bus service that only runs to 9:20 at night, and so in relation to services, that it's the bus service and what we deliver. We need to be minded of that, and our bus service isn't going to be able to support lots of these things.
If I may, Chair, I mean, I don't disagree with that, but I think that's part of what I said. I hope what I said was all embracing, which should, as part of it, not only look to new developments, but what we have at the moment for existing locations. And, you know, the bus service to the hospital has lasted for as long as I've lived in this area as an issue. And each time one thinks one's getting one aspect of it sorted, the next thing starts deteriorating. And a 9:30 finish for the hospital is, of course, a nonsense. But, you know, certain things are probably beyond our control, but nonetheless, we should be taking steps to seek improvements. But I embrace existing facilities as well as new facilities in my suggestion.
Well, you have the committee was 100% behind you on on the public transport issues I was going to say centres of excellence, but any health, the health centres, yes. Councillors, I'm looking around, Councillor Peach.
Yeah, I'd just like to pick up on the point with around innovation. Let's say I've seen firsthand what link lines can produce and how much benefit that can have. So I'd like, if the council with their access and links into housing, if they can try to encourage that as much as possible and get the GPs to buy into that as well, I think that would be of great benefit.
Does anyone wish to speak against it or add to that? Or else we will take that as a committee view. Please speak.
I think I might need a little expansion. I'm not sure I've totally followed what the point is, but that might be my incompetence.
Councillor Peach, back to you.
No, not at all. I probably was quite vague. What I was saying is when you have link line, which at the moment is probably a basic system where you would press a button if you needed assistance. Yeah, that's what I mean. Link line is it literally is. If a person was in a problem, they would literally push a button.
A link line is an emergency button put into some
that's what I'm
properties,
saying.
I believe, they press when there's a problem.
Something. Communicare, link line, there's all different types of it. Yeah. Ah, right. Okay. Yeah, I think I'm referring to how it's managed. So you'd go through to a call centre, and they would either call family for assistance, or they would call an ambulance, whatever the case may be. But what I'm saying is, in addition to that, once you've got the infrastructure in place in the building, which is your telephone lines, which uses the internet, those link line systems are out there that would enable people to, if perhaps their community nurse was visiting them, or they was trained in how to do it, they would be able to monitor their own blood pressure, for example, and it would be sent direct to the GP, and it would save a person having to travel to a GP all the time. And these types, this is a sort of, it just encourages, and you can maintain that more regular monitoring of people. So what I'm saying is, if the technology's there, and certainly I know of housing providers that are willing to invest in that type of thing, then in the council's position to bridge that gap between housing and the medical professional, can we make sure that we continue to facilitate that?
Steve, would you be happy if we put in, where appropriate, embrace new technology in building designs, and would you be happy with those wording?
In fact, if I can just make a couple of comments in response to what Councillor Peach said. I mean, I would seek to embrace what he's saying. The only thing that I'd have a bit of concern is the limitations to it, because there's a danger sometimes with the new technology that one gets absorbed in the new technology and forgets the human element. And whatever one can do through the technology shouldn't obscure the need for every now and then a professional visit, where a professional visit might pick up something else that isn't necessarily going through the link line system. That's the only thing I would say.
Yeah, I think that is the point of it. It is complementary. It's in addition to. It's certainly not something to take over that you will never see your GP again. Then maybe that word needs to be in there, that we can seek technology for complementary.
Stephen, if you're happy with complementary and where appropriate to go in there somewhere, I believe the whole committee would then be behind you. Am I correct? Please say if it's not.
Yeah, bearing in mind, normally that sort of thing is done in an environment where they are physically being contacted by somebody. It may be their nurse or their support worker, whatever the case may be.
Councillors, I'm looking around for anything, any other comments. Councillor Bierman.
Yeah, I'd just like to come back to this question of the interface with home care. I really don't know how one can put it in words of one syllable or simply in terms of how we engage with it. But I think Councillor James was in that same area when she ceased. But the issue is really, we're putting aside care homes, if we're seeking, and I think it's something we should seek, to care for people to the maximum extent in their own homes, because I think they want that in most cases, not all cases, and it's cost effective. But we really do need to up our game on that particular front, because despite no doubt what's on this website, and I think that was more from the clinical angle, in terms of just straightforward care, I don't think that necessarily the resources that are being provided to home helps is adequate. Now, I really don't know how to bring it into this in simple terms, but I feel there are, whilst there are no doubt some fantastic cases, when you hear, and I think this is not just the Daily Mail and other strange alleged newspapers, I think there's a case, for instance, of the carer changing frequently, so that one carer who knows the patient, the user, whatever the correct term is these days, and gets to know the home and the environment and the needs, is just up to speed, and hey presto, changed person, and it takes twice as long and is not as efficient even then when there's a change of personnel. And there are things like that that really do need addressing, quite aside from horrific headlines.
If I move to Councillor James, could I stick with Councillor Beerman's views? Does anybody else wish to add to Councillor James?
I think that is a point in relation to the continuity of care, but the point is also around if there is going to be a move in relation to the strategy we saw tonight away from acute services to the home, which is very positive, and people are going to be at home, that is a health budget. Then we're going to be moving into a social services budget, and that budget is a different budget, and that is reducing, and carers at the moment are not getting petrol money to travel to and from their carers and who they're supporting, so they can go all across town and not get petrol money. Then they're now having to ring in and out when they arrive at their destination, and if they leave a few minutes.
Please, excuse me.
No, it's important.
This is a carer that you're familiar with. This
No,
is
no,
not
no.
the case for all carers.
No, it is. It is. If I could just.
We have a portfolio holder here. I think is more aware of
No,
this.
please let me.
Carry on, Councillor James.
Thank you. And then they're having to ring in and out now. And so what happens is not in relation to one case, it's all cases. And if they leave early, they get less time. But if they stay longer, they don't get any more time. And what I'm saying is, in relation to capacity to be able to manage this increase of people that are living in their home, it is an issue. And I think we need to ask, as part of this committee, for county to come to talk to us, for us to understand the implications of this strategy from a county point of view as to how they're going to manage this budget. Martin's raised one concern, but the reality is they're going to have to support a lot more people at home, and there's limited resources. And when people's needs change, and they may need an extra visit, and they're getting 2 visits and may need 3, there isn't the resources there, and it doesn't change quickly enough. And if there isn't the resources within the pot, they then don't get that visit. And I think it's important for us as a committee to understand the implications of what is being presented tonight on social services at county.
Councillor Osserton, did you wish to come in here?
Yes. Oh, mine not working.
I'm not. Okay. I'm just saying, I think we're getting a little bit out of context here, because the remit of the Health and Wellbeing Partnership is, yes, I can see what you're saying. All we can do is pass back what you're saying to Hampshire County Council and to the supporting people as to what happens with the carers. But that is an issue for Hampshire County Council that I can feed back as a Health and Overview Scrutiny Committee.
We were asked to comment, and that's a comment.
Yeah, that's fine, but that's what I'm just saying. But I'm just saying that we have a remit, and we can only go so far because health is under Hampshire County Council. But yes, I know what you're saying for the carers for our area. Yes. Yeah.
I mean, if I may say, Chair, in a recent visit to a hospital, the thing that was pointed out to me by a very senior medic was this problem, dare I say, I don't know whether it's allowed these days, he had to talk about bed blocking, but it's just something I understand as a term, so I'll use it, that bed blocking was one of the biggest problems for the hospital, and one of the reasons that there was that the bed blocking was occurring was because there wasn't suitable home care being provided. So, you know, it is having an impact on the clinical side. So, you know, if we can ask exactly what Councillor Ostleton has suggested she's willing to do as a request from the committee, I'd be grateful.
So if I clarify, the committee is in favour of asking the portfolio holder to dig deeper into the county council to dig deeper into the home visiting, home help issue. With the two issues, one is consistency of the same person visiting, and the other one was pay. The pay was mentioned. I don't know if that's actually for this committee to look into, but it was mentioned. And I'm trying to think what the third point was. The sheer capacity of it all. Can I ask the portfolio holder if she's got those points?
Can I just ask for clarification from Councillor James? Are you talking about clinical? I'm on. Are you talking about the clinical care given, or the supporting people that come in and do your housework, etc.? Which one were you?
I'm talking about not clinical care, but I'm talking, yes, I suppose it is personal care, not clinical care. And in relation to page 46, the Health and Wellbeing Partnership is formed, and one of the partners within the Health and Wellbeing Partnership is Hampshire County Council's Adult Services. So they're part of it. So what I'm saying is, if we're going to sign up to this strategy, we need to ensure, and we've got questions that we have, and it is a statutory requirement that we have this partnership, and we're meant to scrutinise it, and we should ask them to come in. And I really think that we have concerns here. We've raised concerns tonight, and I would like us for them to come forward so we can ask some of those questions. And it's very limiting in relation to this report.
Can I, Chair? I mean, I would like to just say in support of that, to get from them their explanation of what the limitations are and what they can and can't do in their view would be helpful to us to know in terms of what we can ask of them.
We did hear from the doctor very clear that there are issues of home visitors, home helps, and the different skill levels of people. I can't remember the terminology he used, but he made it clear that it was not far from ideal at the moment. So it's an obvious issue. He has already told us he's looking at it. He's already told us it's one of the issues. So, right, this committee wants to clarify the clinical and the caring side of it. The personal. Just the personal,
We
not
would,
the clinical.
the personal aspect of this, the clinical presentation tonight said they were going to be reducing their budget, which they have successfully. That then impacts on the social aspect of care. And we need to ensure that Hampshire County Council Adult Services can pick up that requirement of theirs. And we know at the moment they're stretched, they're reducing their budget. And we would like to know, we would like them to come in so we can ask them questions in relation to this presentation that we've got and the requirements of this new strategy on them.
Right, Councillor Ostleton.
I could say that you should have Kate Rand.
It's the people that come...
Councillors, I need to sum up here. At the moment, we have a minority view asking for this. Is it the majority view of the committee or still a minority view? So I'm looking around the committee regarding... We have 3 people, 4, 1, 2, 3, 5 people now. Sorry. Is your hand up, Councillor Bierman? 5.
Oh, yeah.
Right.
Just from my point of view, there was a discussion going on, and I'm not entirely sure what it is we're agreeing to at this point in time. That's why I'm not raising my hand. Is it
Councillor, please, can we let the officer
home care, or is it
read out what she has, please?
It's quite clear that the committee have some concerns around the capacity and the continuity of care in the home following the implementation of this new strategy and approach. What we're not clear on is whether we're happy for the committee to note the concerns and have the portfolio holder address them, or whether the committee is asking for direct representation from the county, and it's that issue that needs to be clarified.
Right. Can we please clarify? We have the members here tonight. Those that want to go through our portfolio holder, Councillor Austin is here, or those that want to go to the county. Sorry, Councillor Steele.
Sorry, Mr. Chairman. You're asking us to vote on whether we go to the portfolio holder for clarification. So can we vote on that?
I'm just putting what the two issues are, and then we will vote one at a time. Right. The issue is there. The issue is whether we go through Cathy or we go to the county. All those wanting to go to the county.
Chair, can I just briefly say, as a point of explanation, I'm not personally saying I don't have faith in the portfolio holder in doing her best. It's just that she can't possibly know all the answers and details that a practitioner from the county could respond, because she can only get it second hand. Whereas if a person from the direct representative from the county can be questioned by the committee, that seems to be more thorough, that's all.
Okay, well, I'm putting this to the vote. Those people that wish for the officers to request a county person to come and talk to us, although I'm not sure the timings, it might not be the next meeting, but somewhere, or those people that are happy to go through the portfolio holder. So the first thing is, all those that are, just help me out, just get this correct, I want to be. Those that want to go through the portfolio holder and are happy with that, please show. And I'll stick my hand up because I support Cathy 6. Right, so those people that want to go direct to the county and have a county person to come and speak to us. Right, thank you very much. For the time being, so that vote went that it goes through the portfolio holder. And the portfolio holder will disseminate the information out. No, Councillor Beam has already made it clear that it's not you don't trust her, you just wanted more information. But we've had a vote. That is the situation where we are at the moment on that issue. We're now looking at any
Chair,
further
in relation to that vote then, is it possible at a future committee meeting that Councillor Ostleton will give us a presentation then, so that we can ask her questions about this issue that we have concerns on? I would welcome that if she could come along and give us a presentation.
Councillor Ostleton, would you like to speak?
Yes, can I just say, perhaps the best way forward on this is that we look at this strategy, because it is statutory and it'll go through. And what I'm saying is, yes, I'll go back and put your points to Hampshire County Council and say to them, would somebody be prepared to come and if the strategy, for the strategy to go through, and then we'll ask somebody that we have got questions on the care of these people in their homes, and then I'd be quite happy to go forward. Exactly what we want. Yeah.
Right, although we've had a vote, we've now got both, so that's hopefully that everybody in the room is now happy. Thank you, portfolio holder. Right, we still have an option for any more comments under 2.3 if any councillors wish to bring anything up. Councillor Mrs. Waldridge.
Just a quick one, just as much as I find much in this, agree with it and find it laudable. For example, fuel poverty, financial hardship, recognition that these are major issues in Hampshire. I guess my concern is, given the current climate and the fact that only yesterday we've had another 10% knocked off, the local government's budgets. I just wonder how achievable this is, that's all. And for me, that's quite an important comment that I would like to be taken forward. Whether other people agree with me will be a different thing, but there we go.
Well, we just had a presentation, actually 2 presentations, to people believe it is achievable. I don't know whether you wish to say anything on that. So I hear what you said, but we've had 2 presentations and sat through it tonight.
But they were maybe falling out of yesterday.
Well, he was aware of it, he mentioned it, he brought it up and said it. So we are actually asking for committee comments that are supported by the committee. In which case, thank you for 2.3, we move to 2.4. That we endorse the shared plan to improve health and wellbeing in Basingstoke and Deane, and the Council's contribution to the delivery plan noting comments done in, I'm slightly differently noting the comments in 2.3.
Agreed.
Is that agreed? Thank you very much. Councillor Bierman.
Yeah, can I ask a question? I'm not quite sure how the comments that we've made and agreed, how they will be reflected in how this process moves forward.
Having taken a record of the comments, I will take those back to the Health and Wellbeing Partnership, and we will consider those comments in the final version. So what you have is a draft. We can consider those comments and see if we need to amend the document, reflecting the fact, again, it is a partnership document, and I can reflect the fact that these are your committee's comments.
I'll just ask the officer to clarify what she has.
Notwithstanding anything Marion has just said, just to confirm that the amendments we made under 2.3 will all be a matter of record in the minutes as amendments made by this committee.
In which case, councillors, that is paper C completed. I'm looking at the clock. Is there a wish for a comfort break, or do we plough on? Right, in which case we will keep going. We move on to paper D, which is the project integration plan. Would the officer for the project integra like to come up here, or do you want to if the committee's happy, I'm happy to stay there. Is that correct procedure? Yeah, you can stay there if you wish to. If people are happy, carry on there. Paper D is a follow-on paper from last month. We've all had it in front of us for some time, so we've all read it. Would you just like to summarise it, please?
Thank you, Chairman. Yes, the Chairman referred there. As members will recall, this report was considered at the previous meeting. This committee and deferred as members had not had the opportunity to consider the appendices to the report prior to the meeting. The committee did, however, consider part of the report and recommended to the portfolio holder that Basingstoke ceases funding for the Recycle for Hampshire element of Project Integra. The report in front of this committee tonight therefore only seeks the committee's comments and support to approve the 3 appendices to the report. These are Project Integra Action Plan at Appendix 1, Project Integra Constitution at Appendix 2, and the Hampshire Joint Municipal Waste Strategy Appendix 3. It also seeks support for Basingstoke's continued membership of the Project Integra and continued funding for the materials analysis facility and the executive elements of the partnership. Justification for this continued funding is given within 7.2 of the report. I think that summarises it, Chairman. Happy to take any questions.
Councillors are open to questions now. Portfolio holder.
Thank you, Chairman. I just wanted to put another perspective on it. First of all, I'd like to thank our joint waste team for conducting this review. We have in the past spoken about Project Integra as if it is one thing. As part of this review tries to make clear you're actually dealing with 3 distinct elements. Element 1 being the materials analysis facility, which in plain terms is a way we can do some sampling in order that we can find out what's in our bins. So we know what's being recycled and what's not. We would have to do that work anyway, and this is the most cost-effective way of doing it. Bit 2 of Project Integra is actually us all working together, all the waste collection authorities, the districts, and the waste disposal authority, the county. We have a statutory duty to do a joint plan with the disposal authority. I believe that the most effective way of doing that is via Project Integra, because otherwise county would be doing it in one group with every other district, and we'd have to be going, please, can we do it separately with you, county? Possibly not the best way. As part of that, we would also have a voice at the table with Project Integra, and it's certainly my ambition, I'm pushing it through, is to try and increase the number of items that can be recycled at our analysis site, and that's, I'm being as blunt as I can be in a meeting with Project Integra, and the officers sometimes wince when I say we should be focusing on that at these meetings. And then the third element was Recycle for Hampshire, a Hampshire-wide advertising campaign, which the committee backed with cross-party support last time, that we would be better doing that ourselves because we know our local population better, and our communications department can best do campaigns for our local population rather than the whole of Hampshire. So with those in perspective, what we're asking is for your support to stay in Project Integra and to back their action plans. Thank you.
Councillor Beerman. Oh, my apologies. Councillor Mr. Still did ask first.
Sorry, Chairman. I'm happy with everything the portfolio holder has just said. When I had this brief several years ago and we did the action plan, I absolutely made sure we have written in there that we as an authority retain the right to remain on a weekly bin collection. Because when you have different authorities, something may come along where they discuss, I don't know, I really think somewhere in this action plan there should just be one little sentence that say we as Basingstoke and Dean Authority retain the right to keep our weekly bin collection. I may be paranoid, sorry.
I don't think you are. The portfolio holder will clarify.
I don't think we need it in there, but I'm more than happy to put it in there. I'm very tempted to put it in there with nice large 12-foot neon signs across the action plan. So totally agree.
There is a list of speakers. Councillor Still, Councillor Reid, Councillor Beerman, Councillor Baker. So Councillor Still, you're okay. Councillor Reid.
Thank you, Chair. With apologies to Councillor Beerman, but my name was there first. Thank you. It's just a very quick question to the officer, actually. Page 83-84, so paragraph 8.3. Just want to confirm that our continued membership of Project Integra is offset against, if you like, a cashback, which is coming in at the moment. And so the cost to the council for continuing for 2013-14 would just be £1,176.69.
Yeah, that's correct. That's as in the report. So yes, the actual net cost for the authority this year will be just over £1,000.
Councillor Beerman.
Thank you. In fact, I'm almost pleased that I didn't take the first slot because it gives me an opportunity to respond to Councillor Still's remarks. And yes, I think she is paranoid, but that's another matter. But she did invite the comment. Firstly, I'd just like to start with the. I've now turned the page, I'm sorry. What Councillor Donnell was talking about, what's it called? It's the name I can't find. The materials analysis thing, which is, yeah, I supported the report as it stood, and I think it's going in all the right directions. The materials analysis is just something that's clearly going on and that has passed me by in terms of the outcome of that. I'm not sure, and I might be wrong, I don't remember seeing any report, well, I'm sure I didn't see it, but it might have existed, that goes into what the final analysis is, and I'd be certainly very interested to know what Eastleigh's doing in terms of going in their bin that we are not, and whether one can get a pattern from that and learn something from it. and what the analysis is bringing out. That's what I'm saying, really, a wider display of that, because though I'm not being a professional, that I could necessarily put forward ideas, it might help one understand what's happening elsewhere and where we could perhaps influence to improve our performance where it's not as good as what others are doing. That was just that particular point I was going to make anyway. Just on the suggested additional point, and please listen to what I'm saying, those that might wish to distort it or abuse it or rephrase it on a future occasion. I am not saying that we shouldn't go for or continue for weekly collections if that is the right thing to do. But we have never sat down and analysed it and agreed that all round, all things taken into account, that is what we should be doing. And until we have done that, I think it's premature to say never ever will we do anything other than alternate weekly collections. And so if that goes in there, I won't support it. But as I say, I am not saying we should change from weekly collections. I emphasise it again. I have to say it twice because otherwise it's not understood. I'm saying we need to analyse it, and when we've analysed it, then come to the right conclusion to serve our population and our circumstances. Thank you.
Councillors, any other? Sorry, Councillor Baker.
Thank you. I've got a few questions and comments. I follow on from what Councillor Bierman just said. I'm quite content if the expression "the right to continue with weekly collections," I have absolutely no problem with that whatsoever, because, and I think that's the answer to Councillor Bierman's comment. It's what we're looking for is the right, which doesn't commit to doing anything else if at some point we decide that it's more advantageous. Can I make some comments, please, on the action plan? I am concerned that many of the actions are the measurement. The portfolio holder will know that I have a thing about this, that I think there's a difficulty with that action plan of actually ever being able to look at it.
Could you give us a page number, please?
The action plan starts on page 65 of 113. And if you turn over to page 68 of 113, there are actions and expected outcomes, such as a demonstrable decrease in contamination. Excellent. Is that a demonstrable decrease of 0.0001%, or is it a demonstrable decrease of 10% in the amount of contamination? And I don't know how you'd be able to look back at this in 2016 and know whether it's been achieved or not if you don't have targets which are actually quantified and measurable. So, there are several examples where the aims are there, and they're perfectly good aims, but the resources aren't clear or aren't identified, and the measurement of knowing, it's like, you know, the outcome of increasing the capture of small weed. The portfolio holder has told us we've had 5 tonnes of small weed collected from our Bring scheme so far. So, you know, 5 tonnes and 1 ounce is an increase for us. But I really would like an action plan to have some smart targets. So that's one issue. I'd particularly like to make a comment on the proposed revision to the Constitution, and to say that I would personally like to see in that Constitution a commitment to transparency. The Constitution starts on page 75 of 113, and it sets the detail of when the members of the board, for example, get sent the minutes or the agenda for the next meeting. It says that outsiders might be invited to attend a meeting, and I think this council now has a good record of transparency. Our agendas are published. People can come and sit in on our meetings. We deal with confidential issues. We have ways that we can deal with confidential issues when they arise, but we have a broad underlying principle that what we do and what we're talking about and what decisions are made are in the public domain. And I would like to see that for Project Integra as well. So, and I would like to see it in the Constitution so that that happens. And then just for some questions on the refresh of the core strategy of Project Integra, page 85 of 113 and onwards. I have questions, for example, on page 91 in 4.2, the aims, implementing further material recovery streams, which has already been raised by the portfolio holder. You know, are we thinking perhaps about food waste is one item? You know, might that be one of the material recovery streams? Can we have an explanation, please, of what is in the bullet point further down that page, so it's still on page 91, which is the consideration of funding structures other than traditional project finance. You know, what does actually that mean? Is that mean, are we opening the door to pay as you throw? Or is there another explanation for what that phrase means? And on page 93 of the, so this is paragraph 525.
Could you get the answer to some of your questions? Because I'm going to forget
I'm
the earlier questions.
I'm nearly at the end.
Okay, sorry, carry on.
This is the last one. This is the last one. There's a reference about, which is nice and specific, average annual rate of waste growth to be below 0.5%. And what I would just like to be clear is how that 0.5% is measured. Is that growth per capita or per household or what? So that was the last one. Thank you, Chair.
I will hand all that, hopefully you can remember them, because I'm struggling a bit, to the portfolio holder.
I'm going to start off because I think our officers may be too embarrassed. I think our officers may be too embarrassed to answer as I would answer around the action plan. We have to remember it's not necessarily the Basingstoke and Hart councillors who have written this action plan in total. I would be disappointed and frankly surprised if an action plan written by our officer team was as vague as this. Our officers have been arguing quite vociferously with Project Integra to get them to have more realistic, measurable targets. And that's something that both they will continue to do and I will continue to do. I think if we look back over past years, this is a movement and improvement to where it was. And perhaps this is just another reason for us to reflect that actually our officers do measure themselves quite strictly on most action plans. I don't think they were going to say it that way. Looking forward, I agree with you on the transparency. I think that's a very good point. I had missed it. We were already nodding at each other, and I think that's something we'll bring back to Project Integra. So on the action plan, I would ask the committee support to approve it as it is at the moment, because realistically, it's the best we're going to get this year, but give us the mandate to get it smarter for next year going forward. I'd like to remind the committee also of the sheer amount of change Project Integra in itself has gone through in the last two years. All of its officers too have changed. They have coming through. The new head, I think, is very good, and I'm sure he will improve things as well. So I think this is an ideal time to engage. It's not perfect, the action plan, I agree, but I'd like us to approve it and continue to work on it in the future. That was the first two. John was going to deal with the tonnage. The new funding models, I think it genuinely is new funding models, is how do we do it around recycling banks? Can we sell our recycling in there, around fabrics or some recycling streams that have high value? Certainly I am not keen. I'm not going to announce. I'm very, very not keen in doing any drop waste. I have no plans for doing that in there. Other councils around Hampshire may do. But I think we have to, with Project Integra, we have to think about other things, but as Councillor Still says, reserve the right not to do what we don't want to do.
Yeah, I think it just leaves the measurement of the 0.5%, which is in 525, and just confirm, as Councillor Donnell mentioned there, that is measured on the tonnage. So that annual waste growth is based on tonnage, total tonnage.
So just to clarify, because if we're going to have 10 extra people in the area, that doesn't count into it.
No, I maybe misled you there. It is measured on tonnage, but that would not be total tonnage. That would be the growth would be tonnage per capita, per property. Sorry, I do apologise, yeah.
Councillor Baker, have all your questions been answered?
Yes, they have, and I hope that the committee would be very happy to give the mandate that the portfolio holder was asking for about getting specific, realistic and measurable targets in the action plan.
Councillors, in which case I ask you to look at page 58 of 113, recommendation 2, 2.1. 2.1a is the Project Integra Action Plan. B is the Constitution, and C is the Joint Municipal Waste Strategy. Are we all happy with those? So, Councillor, Mrs. Still.
Can I just clarify that we are going to put into this action plan what I asked for?
I'll ask the portfolio holder to clarify that, please.
Officers will keep me right here. I'm not sure we can arbitrarily change the action plan ourselves because it is a joint document, but I would be happy if the committee approved it with the caveat the Councillor Still said, and I'd be very minded the Cabinet to also approve it with that caveat. Not that that's a lead in any way.
So I've got it recorded as the right to continue with weekly collection.
I'd be happy. I'll obviously listen to the committee and make my decision onwards.
So, and in answer to the question I think somebody else was either about to ask or has asked, item A under the recommendation was to approve the project action plan, but with a mandate to seek smart measurable targets in the future.
Councillor Baker.
And item B, the Constitution, is to ask for transparency. Oh, sorry, Tracy.
So, would you prefer 2.1 little a? Are we happy with that then? As amended. Agreed? Thank you very much. 2.1 little b, Project Integra Constitution, with the added caveat that we'd like transparency. We're happy with that? Thank you. 2.1 little c, the the Hampshire Joint Municipal Waste Strategy. We're happy with that. We're looking around. Thank you very much. So that's 211 done. We now move on to 212. We basically, materials and analysis facility, I don't seem to have much option. Someone has to do it. We're saying we actually carry on with Project Integra doing it. So when we look in the bins, we can have information in front of us what is or isn't available for recycling and so on. Portfolio holder.
Chairman, I think you got missed Councillor Bierman's point around the data. I actually believe the committee has seen a lot of that data in the past. We don't necessarily say, and this data is from the MAF. But in general, whenever you've seen data around, and this is what the mix of what's in the bin, this is the contamination levels, this is what we do, these are the percentages we think is in the black waste stream, all of that comes from the MAF analysis. So actually a lot of the data you have seen, we haven't been very good at telling you where the data's come from.
If I may, Chair, does it, however, mean that there is a report presented to Project Integra members that has that? So there's presumably, I imagine that's not a state secret and could therefore be conveyed on to members if they wished.
Ask the official portfolio holder, it's actually circulated because I believe it exists already, doesn't it?
Just to confirm, as officers, we see a lot of the reports that go prior to the going to the board. Last meeting we had a couple of weeks ago, and that had all of the MAF analysis for the whole of Hampshire, very detailed breakdown. My understanding is that's going to go to the next board meeting, but if it doesn't, it's not secret information. I can make sure you get a copy of that.
Thank you.
Portfolio holder.
Subject to officers telling me I can or can't do it, I'm more than happy to publicise all the reports out of Project Integra. As long as they're open reports, we'll get them on Sinbad.
Thank you. So that is 212. Are we all agreed with 212? Thank you very much. Thank you for the officers for coming back and presenting the paper again. That's paper D completed. Councillors, we're happy to rush on. Paper E, which is, sorry, I've been advised we need to move standing orders. Thank you very much. Paper E, the future of public conveniences. We have the paper here. I'm trying to find it. I'll ask the officer to introduce it.
Thank you, Chairman. Members of this committee considered this topic some time ago now, and there has been an amount of work carried out. What the committee was loath to do was make a decision about public toilets without some further information. So the officer at that time was asked to go away and do some more research. I hope I've done the research that the committee wanted. All the results are outlined in the various appendices for your information. And then really having looked at that and having consulted each of the individual ward members, I've tried to pull together a recommendation for each separate public convenience. So if we just run through those, in Basingstoke Town Centre, you'll be very well aware that we've got the two sets of public toilets. We've got one out here and we've got one round in Caston's Yard. Roughly they cost about £16,000 each year to maintain, and over the next 20 years you're looking at a total of investment in terms of capital repairs of about £114,000. Being aware that the council has ambitious plans to regenerate top of the town, I think my overall conclusion was that neither set of existing toilets really does much to promote the image that probably councillors want for Basingstoke. So if the committee were minded, I would suggest that you ask the project group, which is looking at the top of the town regeneration project, to expand its terms of reference slightly to include looking at what toilet provision should be as part of that whole regeneration project going forward. I think that is the long-term solution in top of the town. But in the short term, the question remains as to whether it's the best use of public money to keep two sets of public toilets open when they're probably no more than 150, 200 yards from each other. If you were minded that one set should close, I tried to pull out for you all the things that you would have to consider, and they're in 5.1.5. For me, the overriding factor was the market, because while the market is there, you have, where it is on top of the town outside the Willis Museum, you have to provide it with water facilities and you have to provide it with toilet facilities. And the closest facility for the market stalls is undoubtedly Caston's Yard. So if you were minded to recommend closure of one set of toilets, I would recommend that you close Anchor Yard and New Road rather than Caston's Yard, and that was the overriding factor for me. One of the things that came up when I discussed this was that taxi drivers use these toilets a lot. They simply want to pull in, use the toilets. Lorry drivers do too. There is a facility in Caston's Yard to park, as you know, but it's not free of charge. So one of the suggestions was that we ask officers to explore whether or not one or two of the bays could be made free for 10 minutes so that people could pull in simply to use the toilets. So again, that's something that if you were minded to recommend closure of one set of the toilets that you might want to consider. Moving on to the cemetery, looking at this, I think you have to provide toilet facilities for funerals. You have to provide toilet facilities for grieving relatives when they're visiting the graveside. Going forward, particularly when the cemetery isn't taking as many new funerals as it is because it's closed, or the toilets need significant investment, it might be that there are better alternatives to the toilet facilities. You might want to put in a different model. You could have a unisex standalone toilet or something like that going forward. So it might be that in the future you want to provide a different type of toilet, but I think in principle you would want to retain facilities there. East Rock Park, I think we're all aware that there was investment needed in East Rock Park, and that has been provided, and the toilets are going to be extended and improved over this year. Stratton Park, this was quite an interesting one because there are two sets of toilets in Stratton Park. There are toilets inside the building and there are toilets outside the building, and initially I started off thinking, well, that's easy, we'll make the inside toilets available to all during match days when there is use, because outside match days you're only talking about 2 to 9 users every day. Looking at it more closely, our streetcar guys are very clear that they don't feel that's good from a security point of view. They're not saying it wouldn't be possible ever, but in the meantime, they don't think it's possible for us to close that it would be good to close the external toilets. So I'm recommending that certainly at this stage, we retain those toilets, and that was supported by the ward member. Buckingham Parade, Kempshot, small usage. It's the only public toilets we have that support a small parade of shops. We have none elsewhere, and I wasn't able to find out the history of why we built those toilets there. I have no idea. Small number of users. The users that we do have, it does seem to be taxi drivers, again, that use these facilities because they're easy to pull in and use. There are alternative facilities for taxi drivers in the town centre. There's toilet facilities clearly at Stratton Park for other people, which isn't a huge distance away. The ward member here could see no reason to retain the toilets. So on that basis, I was suggesting that if you were minded, you may want to recommend closing those toilets. The rural areas, again, these were interesting when you looked at them and when we talked to the parish councils. I think it's fair to say the parish councils, there was little appetite for taking the toilets on, particularly unless we were offering some money with them. Community toilet schemes, again, there was no appetite for those, but I think it's fair to say that none of the parishes, there was no evidence that any of the parishes had actively pursued a community toilet scheme or tried to set one up. So it wasn't that they'd tried and failed. I think it was just at this point they didn't think it would work. I spent a long time on our website because we've got the Disabled Go website, which is great for information about toilet facilities. And I looked at that, and I think there are disabled, because I was very keen that we would have to provide disabled toilet facilities wherever we would be in the rural areas. I think it's fair to say that some of the rural areas, it's probably more easy to set up community toilet schemes than in other areas. But having looked at it, my recommendation would be that we certainly get the community development team to go out and talk to the parish councils about community development, community toilet schemes, and see if it would be possible to set one up. Because I think, to be honest, if you got one set up, it could actually be an improved facility over some of the toilets that we actually are currently providing in the rural areas. If that didn't work, or the parishes were minded, we could look at transferring the toilets. I'd be keen to have your views on whether you think that should be with some money. And then clearly, if none of that was to work, what I would be suggesting is that we bring a report back to you, and then you look at it. So there would be no community toilet scheme. The parish isn't interested. Then you can decide once and for all what you want to do with those toilets in the rural areas. The views of the ward members that where they replied were included in the report. Conscious of time, but I just want to make clear, absolutely clear, about the staffing implications and what I'm actually saying there. If you support my report, that would be two toilets closing out of the whole host of toilets. That in itself does not justify or warrant any redundancy situation, so there would be no current staffing implications. Clearly, over the next 18 months, if all the rural areas were to go to a community toilet scheme, so that the toilets actually closed and therefore no TUPE arrangements didn't apply, then it would be likely that you wouldn't be able to justify retaining 2 posts. But clearly, our policies are all about redeployment, and in a team of that size, I would very much hope that we would redeploy any operatives. But for your information, I have included the redundancy costs, maximum redundancy costs, should in the future you have to lose 1 member of staff. I think the financial impacts are clear. I'm quite happy to answer questions on those if you would like further information. I've tried to make the recommendation as specific as possible to help your discussions, because then you can either agree or disagree, and I'm happy to take questions.
Councillor Beerman, I think, had his hand up first, and Councillor Baker.
How nice to see an officer present a report with such enthusiasm and joy on her face. I thought it was lovely. No, I don't know whether I should declare an interest, really, because I'm increasingly interested in where, as I slowly decay physically, where I can turn to, should we say. In fact, you asking for questions, really, or can I make a comment, because that's really all I wanted to do? It's only brief. I wanted to say I'd have absolutely no wish to inflict ongoing toilets in Buckingham Parade, so I have no problem with the suggestion there if the ward member's happy. As regards the what I hadn't till now realised was Anchor Yard. I learned something new every day, and that's a new one on me, but I pass it frequently and sometimes pop in, but I do certainly notice there's quite a lot of traffic there. I do mean, cars pull up into that little lay-by and people nip in quickly and out again because it is so convenient. And I can't see, yes, I can't see the practicalities of having a short stay 10-minute facility in Caston's Yard, because probably like at the station where you're allowed to stay for 20 minutes to pick somebody up and people stay there for half a day, I just don't know how we're going to police it and monitor it, and I don't think it will be practical. And unless the top of the town review is going to take 20 years to complete, I would have thought that what we have there in the two toilet facilities that we have now could hang on physically that bit longer until we've decided how the top of the town's going, decide whether we have one super toilet or two mini not so bad toilets or whatever else we might want to do. But to close down one that's well loved and well used, well, well loved, I don't know, it's not the most pleasant of environments, but outwardly it doesn't look so terrible and seems to me massively practical. So I would personally be unhappy to see that one closed. I think it's premature whilst all the other work's going on around the area and the reconsideration of it. But good luck to Buckingham Parade. And as far as what one does in the rural areas, I think that's very much a parish issue, although I don't think we can financially totally turn our backs on them, because as it was said by one of the parishes, was it Overton or some parish anyway, said, no, it wasn't Overton, it was another one, we have a lot of visitors, and whilst we're happy to have the toilet, we don't really feel we should be financing it because it's visitors who make primary use of them. And I have some sympathy, although of course presumably their economy is benefiting from the visitors that are coming and leaving something behind.
Councillor Baker, please.
Thank you, Chair. Firstly, I would like to correct an inaccuracy in the report on page 103, para 566, which states that there are disabled facilities available at Overton Library. There are not. There are no facilities within Overton Library. There is a disabled lavatory facility within Overton Community Centre. Very different thing. So I would like that corrected, please.
Just clarify, you want the library changed to community centre, and then it reads correct. Is that correct?
Yes, there are disabled facilities in the community centre. There are no facilities in the library. The library is within the community centre. So are the toilets. It doesn't mean that the toilets are in the library. Yeah, fine distinction there, but it makes a very significant difference to who picks up the bills. That's that issue. The second thing is a question about the financial impact, because the financial impact totals running costs, staffing costs and capital charges to 175k, and therefore says across 11 public conveniences that averages out as 16k running costs per year. Not in my book. If it says running costs are 62,400 a year, including maintenance, then across 11 lavatories, the running costs of the lavatories are 5,600 per year. And I have some comments
Could we let
to
the
make, but
officer
I'll
comment on that?
come back with comments.
Yeah, sorry, it's bad wording on my part. Firstly, in terms of the Overton Library, I can see how the confusion has arisen because I did get it off the website, and of course it will have shown that Overton Library has disabled toilet facilities, because presumably people who go to the library can use the facilities. Yes, so that's how I've picked that up, but I will amend that. The financing, it's sloppy wording really on my part, because the running costs are things like we have to do things like regular Legionella checks, etc., and that electricity, water bills, etc. The staffing costs are the cleaning costs, which are clearly running costs as well. So the cost of operating the toilets, if you like, is the running costs and the staffing costs, and then the capital charges are charged back into them, and that's for routine ongoing maintenance that we charge to revenue, and then on top of that you have capital charges where you have a new roof, a new toilet, and that's the figure that's further down in the report.
Thank you very much for that. So I've just deleted running and written in operating, and that makes that makes a different picture. Then on the estimates of, so I'm now looking at Appendix 4, the usage figures and and the prediction of the one-off maintenance. And I'm just intrigued by how that's assessed. Now, I'm guessing that it's, how long is it since, how big, you know, the size of the facility, how long is it since the last major refit, and therefore how much, is that the kind of way those figures were established?
As I understand it, and I will double check this, but I believe this comes from our asset maintenance work. It was Property Services provided this, and I think it comes from having done detailed surveys of the toilets. So that's why they vary. For the running costs, we did an average, but for the other, we actually had more accurate information as to the level of investment that would be needed.
And my comments would be that we've just had a very interesting and lengthy discussion on health issues, which particularly picks up the future ageing population and the needs of the future ageing population. And I certainly know of people who say that they do feel restricted in their ability to maintain their independence, for example, going out to the local shops, unless they are certain that there is a public lavatory in the area where they're going to. And that is going to happen more and more, as our health paper has shown us, as we get this rapidly aging population across our borough. So I think it's an essential service. I think it contributes to the health and well-being of the borough, that people do have access to a good standard of public conveniences when carrying out their normal living activities, whether it's going to the shop, visiting friends, but or taking part in activities. So I do start from the point of view that I think that the provision of a reasonable quality of public conveniences and accessible public conveniences across the borough is a service that this council should be doing, and should be doing as part of its contribution to the quality of life for our citizens for the future. I would particularly want to pick up on issues about the top of town, and in the entirely appropriate words of the ward member, Councillor Gavin James, who says that both the Castons Yard and Anchor Yard fail to reach bog standard. And he gave me some detail about the male loos in Anchor Yard. I didn't attempt to try and check the information on that, but I did have a look at the female facilities in Anchor Yard and felt that I probably would not wish to use them unless I was absolutely desperate. Yet those are the lavatories that have one of the highest usage. So I would be very much against closing those lavatories until there was a proper thought to the provision of at least one good quality public convenience to serve the top of town. We're looking at an area which now has the late night activities not stopping until 5 a.m. and the market traders arriving almost immediately afterwards. And so that review should not only be about where they are, what need there might be for short-term, convenient short-term parking facilities, but also to what the opening hours should be, on grounds of the unpleasantness otherwise that can be caused for local residents, and indeed for the detriment of public health generally. In the rural areas, I would say that the borough, we can't take it both ways. We're being told by P&I that some of the large villages like Overton and Whitchurch are service centres that are not providing just facilities for their local community, but for a wider area than that. Just so, they are. And indeed for a considerable tourist industry, with the silk mill visitors, people coming soon to visit Bombay Sapphire at Laverstoke Mill, people enjoying the countryside and benefiting perhaps from a nice cycle ride through, and people do, and that's excellent, and I'm really pleased that they do. But they need to have loos to get to, and I don't think we should abrogate that responsibility down to the parish council, because the need they're meeting is a greater one. And so my view is that whether it's in the town or in the rural area, public conveniences are this council's responsibility, and we should not be seeking to pass it off to parish councils.
Right, in which case, Councillor Leaks, please.
The French did a programme on this, didn't they, Closmel? A long time ago. Anyway, we all need them. Tadley. You've got on there that Sainsbury's is open from 6:30 to 4:30. I think that's probably 7 o'clock till about, it's open till 10 o'clock at night, but certainly they don't allow you to use the toilets. If we, that's the town council, had to maintain them, they'd have to put up the precept by 1/5, or that would be 1/5 of the present precept would probably be used on maintaining the toilets. I also understand, I will ask the officer this, they're a rateable asset. Is this true? And also, where would the viewing panel be going if we have no toilets to go to?
Oh yeah. You mean, do we pay business rates on them? Yes, we do, and that's why you'll see that the actual amount of money that you save by closing them is actually a lot less than the running costs, because even if you close them, you still continue to have to pay the business rates. It would only be then if you went on and managed to dispose of the asset that you would lose that liability. And as to the viewing panel, clearly, if we managed to set up a community toilet scheme or moved it over to the parishes, well, then you would use those facilities. But if not, before you did anything, the paper would be brought back here for you to decide.
Thank you. Surely, I mean, we've got 2 facilities at Tadley. I would be quite pleased to see the double unit converted to a single unit, and one of these self-clean like you have in London would be quite brilliant. After all, that's all you need. Sort of a big thing, isn't it, this toilet? We all need it, we all do it, we all have to go, and yet not prepared to talk about it very easily. But yes, I think we do need still maintain one facility in Tadley. When I say toilets, unisex, both side by side they are at the moment, but I would have thought a self-clean facility would be better, and I just think it's absolutely disgusting you pay business rates on a flipping toilet.
Councillor James, please.
Thank you. I just wanted to ask a question in relation to 7.1 and the staffing implications. Can I ask, Karen, have you consulted with Unison in relation to this paper?
We didn't consult with Unison initially because there was no proposal to make anybody redundant. So it wasn't as if there aren't any staffing implications to consult on. Unison were shown the paper and misinterpreted it, unfortunately. So they sought clarity, and Shella has gone through it with them. So it has been explained to them now exactly what is proposed.
Could I ask that the comments of Unison are then forwarded to all members so we have an understanding of what they are, if you're saying that Unison are now happy with that?
I don't believe I have any written comments because what had happened was Unison had sent an email out which I was copied in on. It wasn't that they submitted formal comments to me, and we just clarified the matter. And as I understand it, the chair or the guy from Unison said that he would write to the people he'd written to before to clarify the situation. So it wasn't that there was formal comments going back and forwards.
The other comment that I want to raise, and it was picked up by Paula, is that we had a presentation earlier on health that talked about rapid rate of increase in the number of 65-year-olds. And I just wondered, Karen, were you aware that Help the Aged says that 12% of older people, 1.2 million, feel trapped in their homes. 13% of older people, 1.26 million, do not go out more than once a week. About that over the country, that's 100,000, and never go out. And they suggest that our evidence suggests that the lack of public toilets is a significant contributory factor in isolation of older people. We have a growing population. Are you aware of what is being said by these national older persons organisations?
Yeah, very much so, because when we did the equalities impact, you'll see in Appendix 5, we actually pulled out the age concern report, Nowhere to Go, and that was something that we gave quite a lot of thought to. We actually went through each individual toilet, having regard to people who've got disabilities and who are older. And the reason that we were happy to recommend the closure of the one toilet in top of the town was the fact that you have other facilities, plus there was no evidence that those particular toilets were being used particularly by older people or disabled. We had talked to the Older Persons Forum and they hadn't raised an issue. We'd talked to the Disabled, the Access Forum, and they likewise in Caston's Yard would not like to lose this facility as people with disabilities use it. But when you look at Anchor Yard, not aware that it's used very much, as it's close to the town centre where alternative facilities are available. So we did consider those. In Buckingham Parade, likewise, there is no evidence that that's been used by older people. The Access Group didn't comment on the Buckingham Parade toilets at all. They didn't have any knowledge of those, and the Older Persons Forum didn't raise any issues with that, and as the ward member didn't flag up any issues. So that's why we were saying that, not saying at all that it's not important to have public toilets. And in the rural areas, clearly, the proposal is not to close the toilets. The proposal is to try and set up an alternative approach to running and managing toilet facilities in those areas, because I am very well aware that access to toilets is very important when you're out and about.
I just wonder, we're talking about the paper here tonight is closing Anchor's Yard, which 174 people use that per day. How do you know who they were? I mean, how did you measure that, and how did you determine they weren't older people? I just wondered how you counted those people.
I certainly didn't do a survey. We didn't sit and look at who's going into the toilet, believe you me. The counts were purely done with a clicker, so as you walk past them, so I mean, in reality, you have to have regard to people walking past, and if they walked past 2 or 3 times, or it was kids and they were running in and out, that would count as 2 or 3 times. But that would apply to them all. So while they may not be spot on accurate, they give you a feel for the use of the toilets. We went very much by the discussions with the Disabled Access Forum and also with the Older Persons Forum, and with anecdotal information, because we do see, like somebody said earlier, the taxis pull up and the taxi drivers get out and use the toilets, the lorry drivers pull up. So our feel is that that's who's using the toilets.
But we don't know that they're not. Of those 174 people that use Anchor Yard's toilet, we don't know they're not older people. We don't really know who they are that are using that. We know there's 174 people that have used that toilet, but at this stage we're proposing to close a public convenience in the town, and we don't know who is using it. There's an assumption that it's taxi drivers. I doubt it would make up 174 people using that facility. My concern is that we shouldn't be closing a facility until we actually know who is using it. The other question I wanted to ask is in relation to Buckingham Parade. It was suggested that it wasn't a great deal of use. I mean, I still feel that 20/40 users a day is a lot of people, and it's been suggested again that a significant proportion of these are taxi drivers. I mean, at the moment we're assuming that taxi drivers are making up everyone that's using our public toilets. I mean, again, I'm not happy to support the closure of any public convenience without actually knowing who's using them. I think it's a service that we should provide. I think it's something we should be providing. I remember sitting on this committee before when we looked at this, when Patricia brought this paper forward, and talking about community setting up community schemes, and then the presentation was about the use of the top of town. We can all use McDonald's, and recently I had to go into McDonald's to use a toilet, and I was quite surprised to find that the toilet that used to be downstairs is now upstairs, and you have to climb, I suppose it must be about 20 steps, and only at certain times of the week is the upstairs open. Predominantly that's closed and only open at weekends. So the other areas in the town aren't available. But what I would also urge is in relation to the recommendations, it talks about looking at a map and looking at future development of facilities at the top of town. And I think Gavin James raises this, that we shouldn't be closing facilities until we've explored opening something else. And therefore I just don't know why we've got this paper in front of us. I think it's absolutely crazy. It's all about saving money, and I don't think we have the evidence here to actually determine whether we should be closing any of these facilities. And there's clearly a high usage, and at the moment it's anecdotal that only taxi drivers are using our public conveniences. I really feel that until we actually have more evidence, we should keep them all open. And it's a service, it's a frontline service that this borough should be delivering public conveniences. Whether we need to improve those, whether we need to build a new one, is something that we should look at in improving the top of town. But I really cannot support the closure of any public convenience. And clearly the parish councils are not in the business of actually wanting to take on or look at community toilet schemes. And quite often driving through Overton, going into which I have stopped at Overton to use their public convenience. And it's well placed, and I know lots of people that do that actually use it, and lots of deliverers use that. Is it because it's a deliverer or because it's a taxi driver, does it mean it's less valid what they deposit in the toilet? I'm not sure, but I actually feel that we should be keeping these conveniences, and therefore I can't support the recommendations before us. I think it's all about cost cutting.
Thank you. Councillor Still. Sorry, Councillor Still, could you let the officer go first? Thank you.
Sorry, I just wanted to pick up on one thing. Clearly, if the committee wanted, the way we approached the consultation following the last visit to the committee was that we consulted with the Older Persons Forum and the Disabled Persons Forum. You can see what they said. The Older Persons Forum didn't pick up any specific concerns with any specific toilets at all, whereas the Disabled Access or the Access Forum were quite specific about the ones they valued and the ones they didn't value. I wouldn't suggest to the committee at all that moving forward we ever try to attempt to do a survey whereby we note down a description of who is using the toilet. I don't think that I wouldn't suggest that at all. If you want further consultation, I would suggest again that we go back with more specific questions, perhaps to the Older Persons Forum.
I don't think the Older Persons Forum represent all of older people. I mean, it is a well-used forum, but you have said in this report that of those 174 people using that Aston's toilet, it's made up of, as is all the other sites, of taxi drivers. I don't know how you've come to that evidence, and if it's anecdotal or not, or whether someone has looked at who's going in there. But clearly, we've got a high usage of people using these facilities, but we are determined to close them.
We have Councillor Still and Councillor Peach who'd like to speak. Councillor Still.
Thank you, Mr. Chairman. I just wanted to go back to what Councillor Ms. James referred to on elderly people scared to leave their homes because of lack of toilet facilities. Well, I don't want to generalise, but actually elderly people feel vulnerable using out-of-date, dingy toilets. That is a fact. And these two we're looking at, if I got it right, look that way, a bit old and dingy and out of date. So I was just referring back to the elderly persons, referring back to them. So I do support this paper, and it'd be great if we could just move it on now.
Councillor Peach.
Thank you. Just follow on from that point, I guess if there's 174 people using it, if they were all elderly, they're obviously quite active in that area. And I don't know if that is the case or not. But my question was, if the toilets are closed, essentially what happens to them, and is there like an attraction for perhaps antisocial behaviour, or is there already an attraction for antisocial behaviour? Because I know in other places, you see toilets are not always used as toilets, and you can be, dealing with all sorts of issues, especially when they are run down and dingy. They don't, they're not always used for what they're meant to be used for. Stupid question.
Councillors, it is gone 10 o'clock tonight now. If we move to page 96 of 113, we look at the recommendations 211, and I propose going through them to 2112. Can we, right, 211, Caston's Yard remains open. Is that generally agreed, please? Agreed, thank you. 212. Those in favour, in fact, let's have a vote on this because you're obviously going to get some against.
I have the vote recorded as well, please.
Yes, you have a right for that. 212. Those that agree with the recommendation, please show. Right. You're okay with it. Those that, we're on 212, those that disagree with the recommendation, please show.
Status quo.
Right, it's 4 votes each, status quo. As chairman, I will go with the officer's recommendation. As
Sorry, we didn't count them.
Stephen, could you put your microphone on and please clarify what you did or didn't do, please?
No, and when you asked the question, I put my hand out. I probably put it down too quickly, so I thought it had been caught.
For clarity, please, those who are going with the recommendation as on the paper of 96 of 113 page 212, please show those with the recommendation. Yes. Thank you. Right. Sorry, those against, please show. Right, please, as we've had a request, please can the minutes show the voting numbers? Thank you. We've had a request for individual voting record, I believe, and the individual... Yes. We've had a request for a recorded vote, so that's what will happen. Right, we now move on to 213. Explore the possibility to provide 10 minutes free parking at Cashton's Yard. Those in agreement? 213 this is. Officers be asked to explore the ability to provide 10 minutes free parking nearby to Cashton's Yard's toilets. Yes or no? All right, all those in favour, please show. All those in favour, please show. Against? Please show. No against, so that's carried anyway, thank you. Item 4, the Town Centre MAF be asked to consider the need to provide new toilets at the top of the town. I believe we'll have general agreement on that. Agreed? Thank you very much. 215, Worting Road Cemetery toilets remain open. Thank you. So agreed all round? 6. Agreed? Please show it if it's not. Stratton Park to be retained, yes? 8, Buckingham Parade. Sorry, is there anybody that doesn't agree? So, right, let's have a proper vote, please. We're on Buckingham Parade, 8. All those in favour of the paper, please show. Right. All those that are against the paper, please show. Right, that's carried, thank you. 9. Over the next 18 months, officers work with parishes to explore the opportunity. Are we genuinely in favour or against this one? Agreed? Agreed? Right. Yeah, these are all... let's have a proper vote. All those in favour of... This is number 9. Working with parishes and local communities. All those in favour, please show. Yeah. Yes. Thank you. Right. Well, that's an easy majority. That's carried. Thank you. The existing toilet facilities in Whitchurch and Marybourne be formally offered to parish councils. All those in favour, please. In favour? No. We're on number 10. Right. Yes. All those against on 10? Anybody against item 10? Which is... So there's 3 against or 4? It's carried anyway, isn't it? Right, thank you. It is carried, whether there's 3 or 4. Right, 11. Committee considers... Right, basically whether to look at the funding issue. That's really what this item says, I believe. All those in favour of looking at the funding issue of toilets? Yep. Yep. That's carried anyway. Thank you. Right. 12. Well, yeah, sure, we have to support 12, don't we? Is that Jenny agreed? Yes. Thank you. Yes. Portfolio holder, you wanted to... Did you want to speak, portfolio holder?
Chairman, on 11, as it says whether or not, whether it would or whether it would not, can I take it that officers go away and look at some work around what, if the parish councils do need some funding, what that looks like, and bring it back to this committee? I think that was where we were coming from, but I think the officer wants to elaborate.
No, I just want to clarify, do you want it brought back to the committee before we take the report to Cabinet? Yeah.
Yes, I can't see that.
No, you
Is there any advantage of coming back just before Cabinet? Because
I'm just asking for clarity
we're only
when you want the
advising
report.
Cabinet. Let's.
Sorry, this is not going to, we can't make any decisions.
We-
So is it the portfolio holder alone who's
Just for clarity, I was intending to take the report to the 30th of July Cabinet meeting, but when the portfolio holder said that, I was just trying to clarify in front of the committee whether he wanted me to hold taking the report to Cabinet and do the work on what funding would be appropriate before I present it to Cabinet, or go to Cabinet first and then do the work.
Portfolio holder, please respond.
I think it's during the next 18 months, as you're working with the parish councils and trying to set up the community thing, one of the things we should be working on is around funding, if necessary, any parish councils to take it on. I think the report should go to Cabinet, and as part of the work in the next 18 months, we look at the funding bit.
Thank you, councillors. Time's 10:15 and the meeting's closed.